Members, when we rose, the question was that the Appropriation 2025-2026 bill be read a second time. Member for Vieux Fort North.
Thank you very much, Mr. Speaker. Mr. Speaker, I want to thank you and honorable members. I want to thank the Holy Spirit for this opportunity once again to address this honorable House, to spend time with honorable members to discuss the business of the country. Mr. Speaker, before I begin my presentation, I wish to ask you to allow me to recognize a group of young people who have come from the constituency of Vieux Fort North to observe the proceedings today and to tell them welcome. I also wish to wish all young people in St. Lucia a happy Youth Month. As you know, Mr. Speaker, April is Youth Month, and I wish all young people in this country a healthy and happy journey through their youth, and tell them to continue to contribute to the country of their birth. Mr. Speaker, once again, we see the machinations of the Leader of the Opposition. We know, Mr. Speaker, that tradition dictates that the Leader of the Opposition responds to the Prime Minister immediately after the budget address. This has happened every year, Mr. Speaker, when we were in opposition, and we see once again the Leader of the Opposition playing games with this Parliament, appearing and disappearing, and standing up when he really should not be standing up, just to show people that he is in the House, and he has disappeared once again, Mr. Speaker. It just shows the kind of person, the kind of leader the Leader of the Opposition is. Having said so, Mr. Speaker, I really want to thank the Holy Spirit, from whom I get sustenance. I love and appreciate my family, Mr. Speaker, for the sacrifices that they make to allow me to serve our people. Thanks to my team at the Constituency office, my political team on the ground in Vieux Fort North who assist me, to my constituents who serve in organizations to benefit our people, I recognize your efforts. Speaker, I'm a very fortunate person. So many people love and pray for me. I thank them all. Thank you, Mr. Speaker. Our people continue to believe strongly that the policies of our government will continue to bring development and relief to our steadfast and committed constituency, Mr. Speaker. The constituency of Vieux Fort North, which has stood firmly in the belief that the St. Lucia Labour Party will deliver to them and to the people of St. Lucia. I wish, Mr. Speaker, to also thank the Permanent Secretary, Ms. Daniel, and her staff, all of the staff of the Ministry of Health, Wellness and Elderly Affairs, all the departments, everyone who works at the hospitals, at the health centers. I want to thank everybody, Mr. Speaker, for all of the work that they've done throughout the years to help secure the health and well-being of our people. And I want to thank them because of the work that they've done with me and this government during my tenure. As we continue to work to develop the health sector, Mr. Speaker, I want to tell them I really, really appreciate all of the help and support that they give to me, especially to my driver, Mr. Keenan, also my secretary, Ms. Rambali, my secretary, who is my Ms. Florius, who is unwell, and Ms. Rambali, who is holding on. I thank you both for your dedication and your work. To say that I support the proposals in this year's appropriation bill, Mr. Speaker, would be an understatement. of enormous proportions. Mr. Speaker, the Member of Parliament for Castries East, Minister for Finance, and Prime Minister, I must say, deserves commendation, Mr. Speaker. As I said in the estimates debate, the constituents of Castries East must be proud. The Prime Minister's family must be proud, and I am sure the positive energy of his deceased mother, father, and siblings must be within his aura now, encouraging and inspiring him, Mr. Speaker. This Prime Minister, Mr. Speaker, has worked. They say work smart, but this Prime Minister has worked both smart and hard, Mr. Speaker. He has kept his promise. He has kept his promise to put St. Lucians first in every way. My colleagues have all agreed, Mr. Speaker. We will bring the message of hope and progress to every adult, every youth, every St. Lucian, so that together St. Lucians will return this Prime Minister to lead this country whenever elections are called, Mr. Speaker. I want, Mr. Speaker, I want you to lay your head with me on the rumbling hard floors of 2021. This Prime Minister, as our leader leading into the elections, promised our people to increase attention to health care, to accelerate work to provide greater access to good quality health care, to implement universal health coverage, to incentivize the private sector to provide healthcare services, to complete the St. Jude Hospital, to put more resources in the Millennium Heights Medical Complex, the OKEU, and the St. Jude Hospital, to fund and promote healthy lifestyles, among many other promises. And these were the days of the turbulent times of 2021, 2020, 2021, Mr. Speaker, when the last government was in office. In an environment where the health system was already struggling, Mr. Speaker, it was further compromised by COVID-19. And this Prime Minister took action. He took action to increase the health budget from $183.1 million in 2020-2021 to $206,073,800 in the 2025-2026 budget, the largest ever in the history of St. Lucia, Mr. Speaker. This Prime Minister increased the Millennium Heights Medical Complex budget. Most people refer to it as the Owen King EU Hospital. This Prime Minister increased the Millennium Heights Medical Complex budget from $31,647,939 in 2020-2021 to $70,561,888 in 2025-2026, increasing every year since 2021. This Prime Minister increased the subvention to the St. Jude Hospital from $17 million in 2019 to approximately $24 million in 2025-2026, Mr. Speaker. This Prime Minister increased both clinical and support staff throughout the health system, completed major repairs to health facilities, completely refurbished or are in the process of refurbishing many more, increased allocations of funds for pharmaceuticals, provided resources for the accident and emergency departments at our hospitals. These are just a few of the things that this Prime Minister has done in the health sector. We continue, Mr. Speaker, to take concrete actions to improve the healthcare delivery systems in St. Lucia with the unwavering support of our Prime Minister and Minister for Finance. Cabinet, and with the work of our professionals in team health, we continue to address the gaps that exist in our mission to provide all with accessible, affordable, world-class health care. We are doing a number of things, Mr. Speaker, and we are working with teams from PAHO, from other agencies, from all of our partners, from workers within the ministry and the professionals to continue to refine our vision, our mission as we move forward. But what are we working on? We are working to build a healthy and resilient population with the collaboration of all health partners, Mr. Speaker. We want to foster a robust, integrated, and sustainable health system that provides comprehensive, quality services at all levels, ensuring health equity, resilience to the future, to the future health threats and access to affordable care and financial protection. We want to achieve equitable access to quality health care for all, especially the underserved and vulnerable populations. We want to enhance health system resilience and sustainability. We want to ensure health services that include addressing social and other determinants of health. We want to foster transparent, accountable, and inclusive decision-making at all levels. We want to ensure, Mr. Speaker, that we improve healthcare coverage and equity, strengthen human resources for health, enhance sustainable health financing, improve healthcare quality and infrastructure, strengthen public programs, integrate health systems for better health service delivery, promote health equity and address social determinants, as I said before, strengthen mental health services, and improve and increase public-private partnerships. Let me tell you, Mr. Speaker, what we are working on and what all of us and the people of St. Lucia should expect, Mr. Speaker, what we are experiencing and what we should expect. We are experiencing, as we know, increasing health costs. We know our population is aging. We know that 37% of the health costs is out of pocket, meaning people have to use their own monies directly out of the pocket to pay for medicines and so on, 37%. And although, based on our analysis, we believe there is enough funding within the entire health system, what is the problem is fragmented, Mr. Speaker. The health financing system is fragmented, and who suffers the most? The vulnerable. What we have done, Mr. Speaker, is to work with the World Bank, work with JIPA, the JIPA network, a consultancy firm, and a lot of work has been done over the last few years to consolidate our ideas on healthcare financing. We are not doing like the last government, and they are in opposition now, going all over the place telling people they are going to give them X amount of health insurance without explaining anything to anybody. What we have done, Mr. Speaker, is to present a model to a wide cross-section of the society. We have received input from them, and we are working on it, and I will tell you what we are going to do, Mr. Speaker, what we have been doing. We are going to use a consolidated model or stratified pool risk model, Mr. Speaker. What this means is that funds from various areas will be consolidated or put together, deposited into a UHC special fund where the risk is spread across different funding tiers. The goal is to improve the nation's health profile, reduce healthcare costs, and promote sustainable development. This aligns with the National Strategy for Healthcare, following the World Bank, World Health Organization, and Sustainable Development Goals and targets. To achieve this transformation, Mr. Speaker, the universal health coverage will be financed through a public-private partnership. It will not be fully funded by the government, or it will not be a fully nationalized system. You hear on the other side, again, all they're bandying about is that they had health insurance to give every single St. Lucian. We have not heard the explanation, Mr. Speaker, so I cannot compare what we are doing with what they think they said they would have, could have, should have, and will try to would have done. It's a lot of bluff, Mr. Speaker, a lot of bluff. So we are explaining to you what we have explained to the people of St. Lucia. We will emphasize information and data sharing across public and private sector providers. So right now, the private sector is working in silos, in its own system, the private doctors and the pharmacies and so on. The public sector is working in its own silo, and there is no cross-fertilization. They are not working together. What we want to do is to have an integrated system which is based on information. The proposed benefit plan will be structured into 3 tiers, Mr. Speaker. The first one will be government funded, providing essential healthcare services to most of the population with a focus on primary and secondary care, the essential package of health services. So, for example, cancer screening, dental services, eye care services, mental health services, nephrology, meaning kidney care services, and so on, breast cancer and that kind of thing. The second tier would involve a mix of private insurance, employer contributions, government support, catering to individuals and families who can afford additional coverage. So there's a certain level that the government will cover. There's another level that if you want additional coverage, you can also participate in. And the third tier provides for complex and catastrophic healthcare needs, including overseas care when necessary. This will be supported by reinsurance mechanisms. It's important to understand, Mr. Speaker, that this stratified pool risk coverage model, it consolidates public and private healthcare financing into one system. There will be a universal health coverage authority, and the key features of that, Mr. Speaker, will be the elimination of upfront payments and the reduction of out-of-pocket spending. Remember, 37% of our healthcare costs comes out of pocket. You have to pay for it out of your pocket. We are going to establish a framework that ensures that even tourists can contribute to the healthcare funding. It must be supported by an integrated digital system and, of course, comprehensive legislation. As I said before, we are going to establish the Universal Healthcare Authority. And we are discussing with the NIC and other organizations whether it should be an independent authority, housed in the National Insurance Corporation, or embedded in the NIC and phased off for a while. These are being discussed. Each of these options have their own trade-offs and benefits. In other words, Mr. Speaker, we are creating a framework, and we are not thinking about creating it, we are actively creating a framework which will allow us to fund and finance sustainably the Universal Healthcare Program. Additionally, Mr. Speaker, a Friends of the UHC Fund will be established, and it will be for individuals who want to contribute, philanthropic organizations and individuals who want to contribute. In fact, a few years ago, in Cabinet, we actually approved a Universal Health Coverage Fund to be established under the Consolidated Fund. Technology is important. Today, Mr. Speaker, if you have to look at the landscape information, the information system landscape in St. Lucia, in the healthcare system, it cannot operate by working with each other. It's interoperable. In other words, as I said in the last debate, if a patient goes to the health center, and then this same patient goes to the St. Jude Hospital, and then this patient is transferred to the OKEU Hospital, at every stage, they have to record them. If you gave them medication at the health center, you have your records there with SLUIS, but if you go to another stage in the healthcare system, your record does not follow you easily so that the medical professionals can take care of you. We are going to ensure that we have a system that is interoperable, open source, standards compliant, digital platform, which will be able to process bills, have fraud detection, data analysis, and integrated across all sectors. You cannot have a healthcare system, you cannot speak about a healthcare system if you do not have interoperability across systems, private and public, at the pharmacies, the private doctors, and so on. All of this, of course, supported by very strong legislation. So I'm giving you, Mr. Speaker, honorable members, and the people of St. Lucia, where we are at, a clear idea of where we are going. We are not confusing you by just telling you, oh, we have insurance for you. This is a clear idea, this is the roadmap, this is where we are going, Mr. Speaker. Legislative reform is very important because we have to look at data protection, and while some of this is already existing in our legislation, privacy and so on, we have to deal with that. It's important, Mr. Speaker, that everybody comes on board. And we are not just guessing everybody will be on board. We have had consultations with the various ministries, Ministry of Health, Ministry of Finance, Ministry of Equity, Attorney General, National Security Team, including police, fire, prisons, tourism authority, Invest St. Lucia, education sector, healthcare, the St. Lucia Medical and Dental Association, St. Jude, Millennium Heights, Tapion, Nurses Association, Financial Services Regulatory Authority, NIC, National Insurance Corporation, credit unions, financial institutions, the Bar Association, the St. Lucia Chamber of Commerce, the business sector and youth economy, telecoms and digital companies, to look at digital payments, community-based organizations, churches, associations, even the diaspora, community chairpersons with various sensitization activities. So this has been across the board. We have gone to churches, the pastors and priests and so on are inviting the ministry to come and speak to them about universal health coverage financing. So we have involved, and the consultations continue. There are many other groups that have not been consulted, and they will be consulted. Mr. Speaker, what have we done? We have continued with the World Bank project, which is the PBF, performance-based financing, and this World Bank project has taught us many lessons which will be fed into the financing of universal health coverage. I want to thank the team at the World Bank, thank Edith Villeneuve and her team. Also, I want to thank the local team, the PIU, Mrs. Jeanette Hughes, Mr. Neam Jabatis, and many others who are working on that. And we are trying to increase patient demand for screening and treatment of diabetes, hypertension, and other services. We have to ensure in the PBF that high-quality services are delivered. And third, Mr. Speaker, we are experimenting with an output performance-driven product where you give incentives for performance, which is what eventually the universal health coverage financing will do. So doctors who will enroll in the universal health coverage financing model will be incentivized based on the number of patients they see, the quality, and so on. Because we realize in our system, Mr. Speaker, incentives play a big role in the delivery of quality health care. And the lessons learned from the PBF are teaching us some of the gaps that we have to fill as we move to the financing of universal health coverage. Together, Mr. Speaker, we want to move toward greater accountability, improved quality, and measurable results for the people of St. Lucia. Let me just tell you a little about some of the actions that have been taking place. At the launch of the PBF, the number of registered hypertension cases in the system stood at 1,143 in July 2023. By March of 2025, this number had increased to 1,948. Similarly, registered diabetes cases rose from 849 to 1,096 over the same period. You can speak to Ms. Bissett, the health aide at Lafargue, and also Flora, the health aide at Delsay, and she, not the health aide, but the health center attendant, and they will give you an idea of how the people are getting the services and coming to receive even more services. The PBF project ensures that screening and treatment for hypertension and diabetes are carried out in alignment with the national guidelines and clinical protocols at the wellness centers. Think about it. In July of 2023, just 3,964 patients were being screened for hypertension using the protocols. By March of 2025, that number more than doubled to 8,570. For diabetes, the numbers grew even more significantly, from just 96 patients screened using the protocols, not just patients screened using the established protocols in July. And by March of 2025, in July of 2023, 96. By March of 2025, we had moved to 5,697 patients. And this data tells a story. It is not just that we're getting more cases, but more individuals are coming out and we are picking up cases that require further attention. Again, I want to thank Ms. Edith Villeneuve from the World Bank and her whole team, and the team here at the Ministry of Health, Wellness and Elderly Affairs. But not only that, Mr. Speaker, as we are moving forward with universal health coverage, here is what we are doing. We continue to increase support to our facilities, focusing on quality and quality service. We purchased 2 mammography machines, Mr. Speaker, and for the first time in the history of St. Lucia, you have 2 mammography machines in the primary care setting, one at the St. Jude Hospital and one at the Millennium Heights Medical Complex. We spent $463,000 through the Health System Strengthening Project, Mr. Speaker. And you know what that will do? The training is ongoing. It will advance our detection and the diagnostics for breast cancer in St. Lucia, Mr. Speaker. As you know, breast cancer is the #1 killer among women. If you look at cancers and so on, breast cancer is very, very important. And so the mammography machines will assist. We purchased lasers, surgical microscopes, support to the polyclinic, biomedical equipment, nutrition equipment, dental equipment, and consumables for the Millennium Heights Medical Complex. We continue, Mr. Speaker, through the Health System Strengthening Project to improve the wellness centers. And Prime Minister said it in his speech, the Deriso Wellness Center was rehabilitated this year, Mr. Speaker. It is anticipated that works will begin at Babuno, Richford, Monrepo, and the Lafargue Wellness Centers, as well as the Dennery Hospital, Mr. Speaker. And all of these works should begin before June. In some cases, contracts have been signed. I'm sure if you speak to Nursing Supervisor for Region 2, Ms. Alexander, and her team, they will be elated to know that improvements are happening in the area. In the OECS Regional Health Project, we continue to smart the wellness centers, and the Delsa Wellness Center is almost complete. I visited the Delsa Wellness Center just a few days ago, and the work is almost complete. The member for Choiseul, I am sure, will be happy about that. The Canries Wellness Center, a contract has been signed, and we are still working with the residents in terms of the relocation while we fix the wellness center. The Grace Wellness Center in Vieux-Fort North, Foisson in Babuno, Vanna in Ancillary Canries. These centers are expected to be rehabilitated. The Grand Rivière, Laguerre, and Fossé-Jacques Wellness Centers, the bids have been received, and the evaluation process is scheduled very soon. All of these are World Bank projects, Mr. Speaker, and various contractors from all around the country are applying for these works. Jacmel, Etangs, and Tirochet Milkou Wellness Centers are also down for refurbishment. Mr. Speaker, I am just excited to explain to you why I am so connected to what the member for Miku North said, that we are not like them. We are very different. Even when we found programs from the World Bank and the OECS regional program, you can see the acceleration of the implementation of these programs under the Member of Parliament for Castries East, Mr. Speaker. We continue to enhance facilities. The Betty Wells Urban Polyclinic. The government of St. Lucia took a bold step and a decisive step, Mr. Speaker, to open the Dr. Betty Wells Urban Polyclinic last year during the first week of December 2024. It's important to note that even though the Dr. Betty Wells Polyclinic does not yet have the full range of primary healthcare services, it is providing a critical service which is assisting the Owen King EU Hospital, especially for non-emergency cases. Between January and March, the polyclinic recorded an average monthly utilization of 3,100 patients. 3,100 patients per month. From December 2024 to April 2025, a total of 12,381 individuals accessed services at the Dr. Betty Wells Polyclinic. Dr. Werner and the rest of the team, Nurse Simon McFoy Solomon, you can speak to them, and while they have challenges, still, because it's a work in progress, when you heard the opposition talk about Ki Betty Welsa and all the nonsense that they spew, Here are the figures. Go and tell these 12,381 people that they should not receive service at the Dr. Betty Wells. Go and tell them that. And just December to April, 12,000 people received care. And just a few weeks ago, we introduced radiology services at the Dr. Betty Wells Urban Polyclinic. So the Urban Polyclinic opens until midnight, and it also opens during the weekend. You go and tell the people that this is not important. You can see they are not like us. They do not have the welfare of the people of St. Lucia. They do not have that as their main priority, Mr. Speaker. They're just breaking down and breaking down. Mr. Speaker, it underscores the polyclinic's strategic support to the Owen King EU Hospital. It manages non-emergency cases and reduces congestion at the island's main referral facility. Although we still have congestion, just imagine if we did not have the Dr. Betty Wells Polyclinic, it would have been much worse, Mr. Speaker. Plans are underway for the rehabilitation of the accident and emergency building and the Francis D'Alto building at the Dr. Winston Paris Medical Complex, which will further enhance the polyclinic services. The building has been gutted and architectural drawings have been finalized to move on with construction. I want to say hello to Nurse Alexander, Nurse Lauren Eugene, Nurse Shalama Alphonse, Sulphur City, Mr. Speaker, and the Soufriere Hospital. Some of the services, some of the new facilities with the help of Sugar Beach, and we really want to thank Sugar Beach for their contribution to this effort, the management and staff of Sugar Beach. The Soufriere Hospital has seen major improvements, Mr. Speaker, during our term. And when I listen to the opposition speak about Soufriere Hospital and so on, Mr. Speaker, I don't have all the time today. I can spend a whole 2 hours just on improvements at the Soufriere Hospital. But I'll give you a few. If we have to look at the conditions prior to the recent upgrades, Mr. Speaker, you can see we had severe structural damage from past natural disasters, a compromised roofing, frequent power outages due to unreliable electrical infrastructure, outdated medical equipment, inadequate water supply, poor drainage, limited inpatient capacity, shortage of trained personnel affecting the range of services available. And what did we do, Mr. Speaker? The structural upgrades, full replacement of the roof and ceiling, refurbishment of patient wards, electrical and water systems, installation of a new generator, upgrade of internal wiring, improvement of lighting, establishment of reliable water storage, medical equipment, procurement of modern diagnostic and treatment equipment, including hospital beds, monitors, oxygen supply systems, and laboratory devices, Mr. Speaker. Renovation of the emergency room, pharmacy, labs, maternity ward, and outpatient department. Improved workspace for the staff. And that was Sugar Beach, Mr. Speaker. So again, we want to thank them for their contribution to the works. Rest areas for the nurses, access to reliable IT and communication tools, better ventilation, more comfortable beds for patients, improved hygiene protocols. As a result, Mr. Speaker, at the Soufriere Hospital, patients have access to a wide range of services: pregnancy care, after birth, child, adolescent, women's health, and I can go on and on and on and on and on. Diagnostic equipment, Mr. Speaker. Expanded lab services, hematology, chemistry, renal profile, liver profile, lipid, and you can go on, uric acid, HbA1c, Mr. Speaker, microbiology, serology, and so on. Radiology and X-ray services. In other words, Mr. Speaker, Soufriere Hospital is now equipped with a full digital radiography system offering imaging across all anatomical regions, Mr. Speaker. We can do upper limbs, lower limbs, axial skeleton, chest and abdomen, craniofacial, sinuses, etc., etc., etc. Major improvements at Soufriere. So, Mr. Speaker, it is clear to see that actions have been taken to improve the services at our medical facilities, Mr. Speaker. There are still some ongoing challenges, but we are working with the team at Soufriere to ensure that these challenges are overcome. And once again, I want to thank Sugar Beach for their contribution, Mr. Speaker. We continue to expand, Mr. Speaker, and continue to improve the services, even while we work on the framework and structure of universal health coverage. And you can go and ask Nurse Jeannie Morgan, Nurse Raphael, Nurse Claudius Daisy, the Grosile Polyclinic expansion, Mr. Speaker. We have spoken about it. We will go to 24 hours. The upgrades will include expansion and modernization of the accident and emergency unit, new consultation rooms, increased capacity for medical consultations, a dedicated staff lounge to support the well-being and comfort of the healthcare professionals. And Mr. Speaker, we're not saying if we will do this, or we're not dreaming of it. If members opposite take a little drive right now, take a drive right now and go up to Grosile, they will notice that the facility is being constructed. Mr. Speaker, we continue with other areas. And as the District Medical Officer, Dr. Ajuda, about the Lauritius Wellness Center, Nurse Leandra Anaville, Nurse Serrier. During the last financial year, the Prime Minister made a commitment. And not too long ago, we went there. It was a glorious afternoon. We went there and we opened the Dennery, the Lauritius Wellness Center, Mr. Speaker. Upgraded facilities, maternal and child health, dental. And if you go there now, Mr. Speaker, I'm sure you'll want a health center like this in your community. In fact, the member for Dennery North calls it his mini hospital. And not only that, Mr. Speaker, as we continue to build and reform, despite all of what they say, Mr. Speaker, we continue to expand universal health coverage services. And in Region 8B, you can ask Nurse Bernadette Felix, the nursing supervisor. When we launched our maternal health services in June of 2023, in June of 2023 up to March 2025, approximately 2,490 new pregnant women access our services. Of these, 1,156 women were enrolled in antenatal care during their first trimester, enabling earlier detection of risks and better outcomes. We also conducted 3,555 ultrasounds, provided lab testing to 2,490 pregnant women. Notably, listen well, Mr. Speaker, 1,220 high-risk pregnancies were identified and managed, demonstrating, Mr. Speaker, the system's growing ability to screen and support vulnerable mothers through the universal health coverage. Who knows, Mr. Speaker, what could have happened if they did not have access to these lab tests and ultrasounds. And in Region 7, Nurse Yasmin Gabriel, Mr. Speaker, and all of these nurses and doctors have participated in the response to the challenges in healthcare. The cancers, Mr. Speaker, we recognize the growing burden of cancers, and we responded actively, Mr. Speaker, in the area of cervical cancer. From August 2024 to March 2025, over 3,000 women were screened, and 1,822 HPV tests were performed. Among these, listen well, 299 high-risk HPV samples were detected, representing 16.4% of those tested. Each of these detections, Mr. Speaker, represents a life potentially saved through early intervention. We did not just stop there last year. On the men's health front, Mr. Speaker, during December 2024 to March of 2025, we launched targeted prostate cancer screenings, reaching 450 men, conducting 361 PSA tests, 184 digital rectal exams, and referring 95 men for ultrasounds. This effort represents a significant push to overcome stigma and to improve early detection of a disease, Mr. Speaker, that remains a silent killer among our men. I really want to thank again the healthcare professionals. There was a men's health clinic in the past, and the reports that we have, when we look at the figures, single-digit figures, you had to cajole the men, beg them to come. But with our new men's health clinic, we are providing the free PSA tests free ultrasounds, men are coming in their droves. And I want us, Mr. Speaker, to give the men of St. Lucia a round of applause, Mr. Speaker. So while they are telling people not to go to our doctors, the men are coming to the health centers to do their different tests. Power avec you, Mr. Speaker. You need l'argent pour payer un ticket à l'autre pays, bébé, vini à ti health center, attends, vini pour un petit test, attends. Si porter qui laisse partir ouvrir, mais là, il vient pour prostate test, I pour test tout. Pas me avec you, Mr. Speaker. So, Mr. Speaker, in Region 6, nurses like Shirley Ann Lamontagne, Eloise, Mr. Speaker, and her team have been working very hard. Even snake bite management was launched, Mr. Speaker, and we have support for people in that regard. We established a biomedical unit, as I've said in the past, Mr. Speaker. And through that biomedical unit, we now have more than one we have a biomedical engineer and other trainees and other technicians who have a unit. They have a vehicle now, and they have a schedule of checks. So if you go around the health centers, Mr. Speaker, even at the hospitals, you'll find that you have fewer complaints with your biomedical equipment. There were times when I became minister, we went around, we had biomedical equipment down for years, Mr. Speaker, and there was only one biomedical engineer for the whole island, Mr. Poleon, and I want to thank him for his service to this country. So now we have a whole unit. We have a whole unit, just like maintenance. We have established an entire maintenance unit with schedules, Mr. Speaker. So we are adding layers of responsibility to our healthcare system. And I don't have the time to tell you all of what we have done with biomedical, chemistry analyzer, defibrillators, AEDs all around, Mr. Speaker, ultrasound machines. I don't have the time. There's so many of them. Viewford Wellness Center, Library Wellness Center, Ancillary Wellness Center, introduction of colposcopy clinics, and so on. And all around the country, Mr. Speaker, the biomedical unit has supplied equipment, and they are helping. A difference, Mr. Speaker. Mr. Speaker, and throughout all of this work, all of the work that the Minister of Finance is doing to buttress and to support healthcare in this country, he still has time, Mr. Speaker. That's why I tell you, he's better than them. Better than them, better than them. He still finds time, Mr. Speaker, for the constituency of Vieux North to design and develop the Rambo-Poleon Theatre and Performance Facility, Mr. Speaker. We are going to transform the Human Resource Center at Bellevue into a great Rambo-Poleon Theatre. And somewhere in there, Mr. Speaker, you will see the joy. It's not just going to be a pash, pia thing, you just nail something to thing. It's going to be a well-developed center, Mr. Speaker, and the people of Vieux North will be proud of it. The 10-year passport, our people of Vieux North will benefit from that. The feminine hygiene products for secondary schools. The payment of an additional 2 CXC subjects. I was happy when I saw that, Mr. Speaker, because in Vieux North for the past few years, if you wanted to write Maths and English over, I would pay it for you. Now, the Prime Minister, although he said he's a foreign, and it seems I still have to pay, Mr. Speaker. So, we are continuing to encourage the people of Vieux North to do your subjects. Nurses, Mr. Speaker, for the first year, 2,500, second year, 2,500, third year, 5,500, and final year, $10,000, Mr. Speaker. Where is all the money the member for Miku South said he had? He was the great manager. He was the great CEO of the government. And you couldn't give the nurses a little $2,000 to help them? And you couldn't give the nurses 10,000. Pas même 10,000. Nous pas buy you 10,000. Nous pas buy you pièce 1,000. Mr. Speaker, these people do not care about St. Lucians. They will give millions.
Member for Suzel.
Mr. Speaker, I would like to start on a point of order. The member is misleading. I mean, I like his exuberance, Mr. Speaker, but we actually provided nurses with. It may have been a lot smaller than what has been done now, but we provided.
Well, that's the point.
$1,000.
He gave a figure. He said you didn't give 2,000.
He said we didn't. He said we didn't give anything. He said that.
Yes, 1,000.
You said Upabe pays
Yes,
1,000.
Say a year.
So what did you give?
$1,000, Mr. Speaker.
Please proceed, member.
C'est combien 1,000 nous bail? Nous bail 10,000. Combien nous bail? So, Mr. Speaker, you see, Mr. Speaker, they're challenging. So I want, Mr. Speaker, through you, I want all the nurses to hear that, you know. We are giving the final year nurses $10,000. The opposition is standing up to challenge and say, oh, we gave two. Don't say whatever. So buy kakada, no ka buy real buy, man. Real buy, no ka buy. No ka buy say Nosla, real buy. Anyway, Mr. Speaker, all non-established government employees, daily paid or wage earners, will be given permanent employment after 2 years. 1,900 workers will benefit. Temporary teachers will now receive full salaries. And from January 2025, income derived from pensions will be tax-free.
Member for Beaufort North, I can't give you 10,000 minutes. We have 15 left.
Just 15 minutes. Yeah, okay.
Thank you, Mr. Speaker. So, Mr. Speaker, all of these developments, the Prime Minister and Minister for Finance can get money to refurbish, to have a new Lucia's Wellness Center, open Betty Wells, look, OKEU is coming up, 5th wing, build St. Jude Hospital, do all of that, Mr. Speaker, and still get money to help with CXC fees and all of that. And you are telling me these people are for St. Lucians? They are not for St. Lucians, Mr. Speaker. Let them bring their card and to show the quality of what they did for the ordinary and the business and all people of St. Lucia. Let them come. Mr. Speaker, not only did we work to ensure that the infrastructure, the various facilities in health were fixed and refurbished, but we also worked on the human resources for help, Mr. Speaker. I'm very thankful for the Prime Minister's support to our nurses, and there are other things we need to do to help retain our nurses, Mr. Speaker. There is a retention policy. We have worked with the Ministry of Education. Assistance to the nurses at Sir Arthur is one of those measures, but there are several other measures which we will implement as we go along. Mr. Speaker, the number of community pediatricians has increased from 1 to 2. Additionally, the inclusion of internists and a nephrologists in community clinics has improved access to specialized care. The number of senior medical officers has doubled from 2 to 4, with one now overseeing clinical protocols and standards of care at urgent care centers and wellness centers. The district medical officers, the number has risen from 21 to 29, expanding the ability of primary medical services across the island. The ministry has employed 20 health aides to provide support within communities. In May 2024, midwives across the country received specialized training to better manage complicated deliverables and other abnormalities. Funding was secured and approved for a second drug inspector position to strengthen oversight in healthcare. The Environmental Health Department, 8 environmental health officers were added. So you can see clearly, Mr. Speaker, that we are not only focusing on the infrastructure around the country, but we are increasing the human resources for health. We've also started our school health desk initiative, Mr. Speaker. A pilot is going on, and hopefully all schools will be tied into the school health desk, where all schools will have certain screenings and so on done and entered into the health information system. Our dental program, Mr. Speaker, teaching good oral behaviors for Healthy Start program in schools. All preschools were contacted, the staff. This initiative also facilitated the production of a children's book entitled Sarah's Visit to the Dentist. It was launched on March 20th to observe World Oral Day. I want to thank Ms. Christabel Christoph, a former dental assistant who caused this book to be produced, the author, Mr. Speaker. I want us to give a round of applause for her contribution, Mr. Speaker. And the dental unit continues to go to the elder care homes. They were just at Comfort Bay, really doing work to advance dental care in St. Lucia. Very soon, you will see a bus, a mobile dental care unit in St. Lucia. They are working on it. So very soon, they will have this other opportunity. You know, Mr. Speaker, that NCDs play a major role. And our departments have been working on the HATS technical package. 20 primary care facilities were engaged, right now 34 across the island. And you know, Mr. Speaker, that non-communicable disease is a major problem. We also caused the NCD Commission to be convened. Mr. Speaker, the St. Lucia Moves program, Dr. Sierra and her team are in every nook and cranny of St. Lucia, encouraging the organizations to do health walks. And we see in the business places, the schools and other organizations, we see the community taking up the business of health. And you see it all around St. Lucia. I said that before in this house. They are not waiting for the Ministry of Health anymore. They are doing it themselves, recognizing that good health, the investment in good health is really, we have to invest in ourselves, the preventative measures. And these preventative measures, Mr. Speaker, are free and low cost. Waking up, walking, breathing in fresh air, staying away from environments that are polluted, trying your very best to keep your communities clean. The hurricane season is coming. Community cleanups. Don't wait for the government to do it. Mosquito breeding areas. You walk, exercise, watch what you eat what you grow. All of these, Mr. Speaker, are measures that we can invest in ourselves, Mr. Speaker. Go to the doctor regularly. Invest in it. Some people tell you, oh, Marla Health Center, Menpo SP, whatever. And if you want to go to your private doctor, go to your private doctor regularly. Do your tests every 6 months, every 8 months, whatever it is. These are the measures that will prevent you from spending hundreds of thousands of dollars or thousands of dollars in the future. Let us have a culture of prevention, preventative measures, Mr. Speaker. And that is what the St. Lucia Moves program is all about. I saw just recently some young people, spoken word. There's this spoken word program where they are using the spoken word to encourage people to live healthier lifestyles. And all of that is very good. That is the only way we will curb the congestion at our hospitals, the violence, that we should have more, conflict resolution training and play some more. The play days we are having in the different communities with children. Do not take these for granted. Not enough children and people are playing together in this day and age. Everybody's on their phone. So all communities where you see you have community activities, whether it is cricket or play days or family days, we need to encourage more of that, because nous c'est moun, nous pas items. We must interact with each other. And that is where children learn how to resolve conflicts. When they're playing their marbles or their games on their phones together, they can resolve conflicts. So all of that, Mr. Speaker, with mental health and so on, we are trying to promote. The Taiwanese mission, I really want to thank the government, the people of Taiwan, who are helping us with our NCD projects. The project is about capacity building. A number of our professionals have gone to Taiwan. This is the third batch for 6-week training, doctors, health aides, nurses, and so on. And we are looking at a multidisciplinary approach to managing hypertension, diabetes, and chronic kidney disease, and so on. The outreach, I've told you, many outreach programs are happening. And together with our professionals, we have developed an app, Mr. Speaker, the iScreen app. So the Ministry of Health professionals and the Taiwanese professionals have developed an app. What it does, when the professionals, the nurses and so on, go to your homes and so on, instead of writing everything on a book, there is an app. We have developed an app where they put the information in, it goes into the system, and we can manipulate, we can gather data from it. So again, it's not just administering medications. We are developing a system where we are creating knowledge, a knowledge-based health system. We are creating knowledge. We have developed an app. And I really want to thank them, and I want to encourage the young people to continue in that way. The Optronics organization, the PM attended the activity and gave them some support. And there are other young people with organizations that can develop apps. So if you can develop apps for health, there are some. I've seen one or two during COVID especially, young people developing apps to help us with diabetes and hypertension. You never know. Come to us and you never know the partnerships that we can develop to help our people realize that NCDs is a big problem in St. Lucia and we need to do something about it. The enhancement of drug monitoring and prevention efforts, the National Early Warning System, we participated in this by the Inter-American Drug Abuse Control Commission, and I'm very happy about that. The Elderly Affairs Department is taking shape. We have our director, we have an officer, we're getting another officer. We are having final consultations on the policy, and I wish to thank the Prime Minister for always taking care of our seniors, always taking care of our elderly. You notice the Prime Minister expanded the program for elder care, and the people of Vieux-Fort North, the elder care workers will know that. Ces gens qui pour casser gomouna, Premier ministre la mette plus l'argent là, et nous avons plus de monde qui travaille là, et nous travaillons à le week-end aussi, avec ça c'est un bagage nous avons gardé pour.
Member, you have 5 minutes left. Leader of Government Business.
Yeah, Mr. Speaker, I wish to move that Standing Order 32.8 be suspended to allow the Honourable Member an extra 15 minutes to complete his presentation.
Honourable members, the question is that Standing Order 32.8 be suspended and Standing Order 32.10 invoked to allow the member an additional 15 minutes in which to conclude his presentation. And now for the question, as many as have the opinion say aye. Aye. As many as have a contrary opinion say no. I think the ayes have it. The ayes have it. Please proceed, member.
Thank you very much. Thank you very much, honourable members. And so, Mr. Speaker, we continue to focus on our elderly. We continue to focus on our elderly. We implemented the 80+ program, and the 80+ program continues to evolve. We are getting data from the hospitals to ensure that we can cause the 80+ program to evolve and take complete root in the hospitals. And as soon as all of this data is collated and so on, we will make an additional announcement in that regard. We see the pensioners again getting some support of $600 in November, Mr. Speaker, and the Prime Minister has indicated that the elders, the pensioners, their pensions will be tied to cost of living and so on. So, Mr. Speaker, we have a government, the government cares about children, babies. The government cares about you in the womb, maternal and child care. The government cares about you, adolescents. You see our programs in the school health desk. You see our programs for early detection of cancer. Cancer, qui est un bagay qui ka trois cassé nous en chai. Cancer à tété, breast cancer. We have gone one step and spent over $400,000 to purchase mammography machines. Ça c'est une machine qui a détecté cancer à tété, madame, bonnet, comme ça yo ça joint traitement. Nous savons cancer à tété a tué chaque madame en cette ici. Avec gouvernement ça là, mettez une machine en Saint-Jude, en sud pays et une machine en nord pays en OKEU. Ça c'est un gouvernement nous pas ça faire tout bagaille one time mais ça ka mucho, ça c'est un gouvernement qui petit et pas en pas ka mettre bagaille en place by santé pays. So Mr. Speaker, we continue to cause work to be done for in environmental health. And this is a very important department, Mr. Speaker, because when we speak about healthy living and well-being, this department is tasked with so many responsibilities. The port health at our ports, so many ships, a total of 2,918 vessels, for example, and aircraft underwent full risk assessment. Many people don't know that, but the Department of Environmental Health must ensure that the risks are assessed. If people are coming on, whether it be cruise ships or airplanes, the places they are coming from, are there communicable diseases, are there epidemics? so they can guide us. The Department of Environmental Health, many people think of them as people who control vector, like mosquitoes and rats and so on. But it's much more than that. And every time I speak about mosquitoes and rats and so on, people speak about, oh, there's no fogging, where's the fogging and so on. But I always say to them, you are the first line of defense. If every single individual cleans around their home, the whole community is clean. Just think about it. If you have a drain, the drain that's passing right in front of your home, just get up in the morning and clean your section. The next neighbor, clean your section and clean your section. The whole community will be clean. When I grew up, we used to have football on a Sunday. We cook a macabu, we get a crayfish or something, and we clean in the whole area. That was part of how we grew up. The government has a role, of course. Once a year, twice a year, you do a big cleanup. But it is the community. Say, nou mai gwen kay morde. Lani kome vieta ya boka yo kadi, oh, gouvernement kay vintiye. Gouvernement, mai gwen kay morde gouvernement. It is you, the mosquitoes and the rats and so on. You have old tins by your home, you have all kinds of nonsense. Old vehicles, derelict vehicles, and I know the Minister for Education and Sustainable Development, they are working to get rid of this. But we have, as a country, not only to raise the consciousness of people, but our own lives are at stake. So when the Environmental Health Department, when their officers are going around and some people are giving them pressure, say man, you know, what we don't realize, you're affecting the next person, you're affecting the community, you have receptacles at your home, mosquito breeding, then we have dengue, we have epidemic, and then that connects to the hospitals, it connects to healthcare. We have to put more resources into healthcare. Dengue, hemorrhagic fever, you can actually die. You can die as a result of this thing. So when the mosquito is not just a simple thing. So the Environmental Health Department continues to have awareness drives, and I want to thank Ms. Cheryl and her team for the work that they've done all around St. Lucia. We appreciate you, and we appreciate your work. We know that you are working very hard, and we know that you live right here in St. Lucia. You can't run to any country, so we have to work to ensure that our environment is clean. Mr. Speaker, I want to say to you that over the period, the Ministry of Health, Wellness and Elderly Affairs and the Prime Minister, we've been working very hard with the hospitals. Our hospitals have been on the strain for a very long time. Our hospitals have been underfunded, Mr. Speaker, for a very long time. And what we are trying to do, what this Prime Minister is trying to do, is not only to resource the hospital with increased funding, and I've given you an example of how, two examples of how this Prime Minister has increased the funding, both for the OKEU Millennium Heights Medical Complex and the St. Jude Hospital. But funding by itself, just funding by itself will not solve the problem. We need proper management, we need proper systems, we need proper accountability, and we need people to do their work. At the St. Jude Hospital, Mr. Speaker, over the last year, again, we see an increase in bed occupancy. A number of people, because of various reasons, but especially because of non-communicable diseases, shaimoni, high blood pressure, pisa du, se malade sala, stroke ek di fwa bay kosa, shaimon ka tobe malade avec se malade sala, avec St. Jude. We know that the bed capacity is a problem, but during the year, the government assisted St. Jude, Mr. Speaker, to increase the bed capacity. That was done. An additional 8 beds for surgical, 8 beds on the East Wing, and 8 beds for elective surgeries. Mr. Speaker, it was supported by the procurement of 20 additional hospital beds. Mr. Speaker, we spoke about mammography at St. Jude Hospital. The training is being done. And St. Jude Hospital, to improve service, also implemented teleradiology to achieve 24-hour turnaround rate for radiology reports. That is very important, Mr. Speaker. They expanded endoscopy services through provision of a special room. Patient feedback, they are gathering even more patient feedback, Mr. Speaker. They have developed the commissioning team, and we are hoping that the commissioning team, not hoping, but the commissioning team is working with the government and the ministry to ensure that we have proper commissioning of the St. Jude Hospital. Mr. Speaker, we had some capital works to the radiology unit, the dental unit, the medical ward, pediatric ward, the operating room, and so on, Mr. Speaker. The hospital constructed a day surgery waiting area for patients and families to feel much better while they await procedures on their relatives. There are still a number of challenges, Mr. Speaker. The gap for nurses at both hospitals, but the St. Jude Hospital continues to hold its own despite all the challenges. The Millennium Heights Medical Complex, Mr. Speaker, I want to thank the new board under the new chairman, Mr. Speaker. I want to thank them, and I want to thank the new management, and to say to them the government will support them in all of their endeavors. Capital works, Mr. Speaker. 5 million for the secondary care facility. The hospital had to repair the chilled water insulation system. The hospital had to rehabilitate a ward at the National Mental Wellness Center. The hospital had to upgrade the sewage treatment plant. The hospital had to install a backup generator. The hospital had to upgrade the building management system, repair and upgrade the fire alarm system, upgrade the cold water system at the National Mental Wellness Center. The hospital also had to refurbish the pediatric ward at the OKEU, repair and upgrade the medical gas pipeline at the OKEU, mold remediation, Mr. Speaker. So this hospital, the various boards of management, they have been working very hard, Mr. Speaker, with management to cure these problems, and all of these issues that I've spoken about are being worked on as we speak, Mr. Speaker. It says to you, Mr. Speaker, that the management and staff of the OKEU are not just sitting there on their hands. They are not just sitting, and many of these problems were problems that were inherited, Mr. Speaker. Many of these problems require diligent, systematic work. This is a hospital. And so when the opposition shouts out about OKU this and OKU that, I want to ask them, between 2020, when they had to forcibly move the hospital, and before 2020, what did they do to ensure that the hospital was properly transitioned? What did they do, Mr. Speaker? Yes, equipment gone. They spent $25 million in a consultancy, and all of these systems had to be fixed, Mr. Speaker. Yo pas ranger ces problèmes là qui sont à l'hôpital là. Yo bay 25 millions pour un consultancy. Avec yo quitté l'hôpital là comme dette. Et qu'à présent yo les plateformes qu'a parlé Moussa this Moussa that. Ça va échapper yo, Mr. Speaker. Ça va échapper yo. We have accepted, Mr. Speaker, that the problems that are in health, we are going to soldier on and fix those problems one by one, Mr. Speaker. We have taken on the responsibility of not hiding and running like they did, Mr. Speaker. And I've showed you in my presentation. Except tout temps, Mr. Speaker, many don't want to live là. C'est moi qui buy. There are things that we have done, Mr. Speaker, and before the time, we are going to explain to the people of St. Lucia what we had to do to fix problems, and we continue to fix problems. For we are not there complaining and saying that we don't trust our doctors and our nurses, and that one will go in the annals of history. That one will follow them like their shirt, their coats, their tail coats, it will follow them, Mr. Speaker. What we are doing is we are working with the professionals to ensure that we increase services and we improve the conditions. Not only in the infrastructure, but the Millennium Heights Medical Complex They continue to strengthen systems, the accreditation system, both that hospital and St. Jude. They are working on accreditation, Mr. Speaker. They are working with Accreditation Canada. They are building systems which will bring in the Tapia Hospital, Mr. Speaker. And they are working with the management of Tapia Hospital to formalize informal relationships that have existed for a long time. And I've said before, doctors and nurses always collaborate in the health system. But we want there to be one health system where one can lean on the other's expertise and everybody can benefit. The supply chain management issues, they have moved to improve the service and delivery across the Millennium Heights Medical Complex. They have expanded clinical services, Mr. Speaker. At Millennium Heights Medical Complex, they have strengthened mental health services. The strategic and administrative developments, Mr. Speaker, they are working on an institutional strategic plan, which will have a new mission and vision and structured operations. I spoke about mammography services. There is a year of engagement where they will engage the community, the staff, and everybody to continue to improve the hospital. And I've spoken about the infrastructure, Mr. Speaker. I tell you, we are going to engage all doctors, all nurses, anyone, Mr. Speaker, who wants to put their hands, their minds, and their soul in the improvement of the healthcare sector in St. Lucia. And we continue to engage them. We have contracts with private organizations, with labs, to provide services. We have engaged new services with our doctors, internists, Mr. Speaker, and I'm having glowing reviews of those new services, Mr. Speaker. Internists at Soufriere, at Vieux-Fort, okay, gynecology services, we have expanded all of those. So we are on record, Mr. Speaker, and the evidence is there to show that we have moved in a positive direction when it comes to healthcare reform in St. Lucia, Mr. Speaker. And while we look at OKEU, we recall the Prime Minister making the bold statement and taking the decision that we are going to build a fifth wing of the OKEU hospital, Mr. Speaker. Fifth finger, Mr. Speaker. Again, that's going to be a glorious
Remember, you
day
have 5
when we
minutes left.
begin. Thank you, Mr. Speaker. And the St. Jude Hospital, Mr. Speaker, that by itself is not just going to be an opening. It's going to be not just a carnival, not only a fashion statement. It's going to be a bold statement of confidence in the government led by the Member of Parliament for Castries East. Mr. Speaker, all of the support to St. Jude and the OKEU didn't stop just there. In the budget, the playing fields in Vieux-Fort North will get support. The Bellevue playing field, we were delayed. We were delayed, Mr. Speaker, but now we have completed the main drains. We are now going to do the resurfacing. Mr. Dwayne Edward will be engaged to ensure. Then we are going to build a washroom, and we are going, hopefully in the next few months, the people of Vieux-Fort North and Bellevue can have a grand opening ceremony for that. The Piero playing field, Mr. Speaker, I'm not going to say anything, like I always tell my people in Vieux-Fort North, say, lemo tractor ek lemo ba ina pali. Na chen si gwe mwen toujou. So the Minister for Sports will talk about the Piero playing field. I know what's happening. I have seen things, but I'm not saying anything. The roads, Mr. Speaker, I thank the Prime Minister. We have started work on the Zabo to Bellevue playing field, road. Last year we said that in the Parliament, and I can report this year that significant progress has been made. We are starting the Grace Woodlands Road. Just the cleaning that has been done, Mr. Speaker. The people of Grace, I know you are anxious, but it's just the cleaning works we are doing, and the full works are coming right after it. The Prime Minister did announce Canels Kako Vige to Piero Road. It's a major road, Mr. Speaker. You know, it's a difficult road, and we are going to deal with it. I'm very happy for the land proposals. There are people from Vevacel, Larry Tuet, Opicon, Grace, Bellevue, where they are on crown lands, Mr. Speaker. And they have not only been there for 30 years, they've been there for 40, 50, 100 years in some cases. And I'm very happy that some of these people, Jashos and the people at Vevacel from Palmis, all of these people at Vevacel who have asked me the questions. You too are part of this development, Opicon. But the one thing I want to say, Mr. Speaker, people who have been there for 30 years, pas comment say blow, comment say me chop like wood le terre, because we are not encouraging squatting. I have said so in this house before, and I'll say it again. A lot of the people who have built houses on top of the Pero Hill, ça pas terre gouvernement, ça c'est terre NIC. Bon, NIC qui vini pour pointer. I only hope, and I've said so in Parliament, I'm not afraid to say it. I only hope the people who have occupied lands at the top of the Pero Opicon Hill, les mettre terre qui vini point, pas dit moi c'est un vieux politicien. We support you. If you have been occupying the lands for a long time, there is Proud. Proud has a subdivision now. Proud qui vini. You can vente by moun ki pate ni pièce. They will have a lower fee for people who have been living there long. Mais pas just I make kaila because you turn gouvernement kay bayte. On y pour la pour 30 l'année, 30 years. Et qu'on kay joindre papier te. So pas di ma aimé, nous just vle bagay fait. Bon, nous pas vle pièce. Là nous regarder view Fort North in the next 10 years. Vous voyez combien vieux bagay par là, la pa ni sou par là, la pa ni chimé par là. Non. Nous voulons bagay nous fait propre. So, all those of you who live at Vevacel, those of you who live at Lautouet, Hope Estate, en Guas, ou quand vous êtes le gouvernement pour 30 l'année, moi ça c'est Willy, là ni tellement moun me connaît. Ça fait ou kay manger. Ça fait ou kay manger. Mr. Speaker, I just wish once again to thank the Prime Minister and thank cabinet colleagues who have stood by me and the government and the people of St. Lucia with healthcare reform. Everything is not perfect, Mr. Speaker. There are many areas where we still have gaps. But in 3.5 years, Mr. Speaker, you can see what we have done. And you can go back to see what they said they would have done. And the difference is very clear. The Member of Parliament for Castries East has demonstrated that he cares about the people of St. Lucia. He promised and he has delivered, Mr. Speaker. I am sure the people of Vieux-Fort North and the people of St. Lucia will return this man, the Member of Parliament for Castries East and Prime Minister, to the Prime Ministership of this country whenever elections are called. I thank you, Mr. Speaker.
The member for Choiseul Saltibus.
Sing. Whatever my strength is. Thank you very much, Mr. Speaker. Mr. Speaker, as is customary, I wish to extend greetings to the constituents of Choiseul Saltibus who are responsible for me representing them in this honorable parliament. I also want to give thanks and praise, Mr. Speaker, for the strength that has been bestowed upon me by the Almighty to provide servant leadership. Mr. Speaker, there's one thing I've always said. Being in this position will never change who I am, and it will never change my character. I'm elected to serve all the people, even those who did not support me. Mr. Speaker, I note that some colleagues before me chose to quote the Bible. And I have selected a creed which I believe should be for all parliamentarians. Philippians chapter 2, verses 3. And it says, Mr. Speaker, do nothing from selfish ambition or conceit, but in humility count others more significant than yourselves. And that should be the creed for every single one of us here, Mr. Speaker. And why do I say that, Mr. Speaker? Because, Mr. Speaker, there are some people who believe that they are the parliamentary representative for Choiseul Saltibus. Mr. Speaker, I have always said, Mr. Speaker, that anything that is for the benefit of Choiseul Saltibus, I will support. And so when, Mr. Speaker, I post on my page to the whole of St. Lucia and the world to come to Choiseul to support jazz, Mr. Speaker, and some people believe that I am in no position to post on my page as a parliamentary representative asking people to come to support jazz in Choiseul because Bradley is not the one who's bringing jazz to Choiseul. Mr. Speaker, Choiseul Jazz, there are a number of vendors who will benefit from jazz coming to Choiseul. And I have to support it, and I have to try to ensure that as many patrons as possible come to the community. And I want to tell the Prime Minister something. I want to tell the Prime Minister, Mr. Speaker, that's my introduction, you'll get your turn. You'll get your turn. That when he is selecting a candidate, make sure that person is person-centered and not self-centered. Okay? Make sure. Mr. Speaker, in that same spirit and character, I would like to also invite the whole of St. Lucia to come to Choiseul on Friday to support the Choiseul Craft Masters during battle against the Soufriere Stompers. And as our record has shown, Mr. Speaker, excuse me? That is tomorrow evening at 7:30. It is the SPL. And Mr. Speaker, hopefully other members will not speak so much. I'll be able to get out of it. And Mr. Speaker, I just want to, of course, boast about the performance of the Choiseul Craft Masters. Every game that we have played so far, we have been victorious. We defeated the Mikud Eagles, the Babono Leatherbacks, and the Monrepo Pioneers. And the Monrepo Pioneers surely got a terrible whooping, Mr. Speaker. So, Mr. Speaker, come Friday, come support us. And I'm hoping also to see the member for Castries Southeast, because they have the South Castries Lions, Southeast Castries Lions, praying on Sunday at 7:30. So I want to encourage all of you all, Mr. Speaker. Because you see, Mr. Speaker, the people who want to spread hate, I'll tell you one thing what hate does, huh? Hate promotes cancer growth. Okay? And let's stop that, okay? Let's stop it, Mr. Speaker. So, Mr. Speaker, I would also want to take the opportunity to sympathize with the many families who have lost loved ones. As I've said in the House, in recent times, my community seems to be going through what is locally termed Basil is in the area. And, you know, the most recent death, Mr. Speaker, I want to sympathize with the family of Mr. Matthew Jean-Baptiste, better known as Daus, who runs a disco called Why Wonder Disco, or used to run a disco, Why Wonder Disco. And one of the first dance halls, or modernized dance halls and bars in the community. He passed away after a brief illness, Mr. Speaker. So, Mr. Speaker, as I come to the substantive part of my contribution, Mr. Speaker, and I was telling the member, the member in charge of government business, that it would be nice if he could have done what he did for the Prime Minister and give me uninterrupted time to make my contribution. Because there's a lot I want to say, Mr. Speaker, this evening. There is a lot that I want to say. Okay, Mr. Speaker? So, Mr. Speaker, we will start. Mr. Speaker, in reading through the budget address and also listening to the Prime Minister, I am tempted to say, Mr. Speaker, that I believe a significant part of the budget address, particularly what was dealing with the policy proposals, Mr. Speaker, I truly believe, Mr. Speaker, that was AI generated. Mr. Speaker, I believe the Prime Minister and the team went on, is it ChatGPT, and they put in certain parameters as to what do the people want, and the search engine went and followed all UWP meetings. It went and followed all UWP meetings, Mr. Speaker, and it picked out some of the things that we were saying that is required by the people of St. Lucia. So, Mr. Speaker, I will say and I will admit, there are things that I support. There are things that I support. There are things that I believe in as well, yes. But, Mr. Speaker, what the reality is, how much discussion, how much consultation, Mr. Speaker, went into a lot of what was put. And why I say that, Mr. Speaker, because this is the Bible of the budget. This is the Bible of the budget. And this does not reflect what the Prime Minister has put down in his proposal. There's no place in that, Mr. Speaker, that I can see what the Prime Minister has put on. So, as has been said in certain quarters, this appears to be a manifesto, Mr. Speaker, and the people of St. Lucia, we should not be fooled by that, Mr. Speaker. So, Mr. Speaker, as I said, Mr. Speaker, there are areas that I support, Mr. Speaker. So, Mr. Speaker, let's take a deep dive into the Prime Minister's budget address. Mr. Speaker, I wish to comment on a very early statement in the Prime Minister's address. In fact, in his introduction, the Prime Minister said, and I turn your attention, Mr. Speaker, to page 3 of the Prime Minister's address. The Prime Minister said, Mr. Speaker, my government's first order of business was to arrest the level of waste, recklessness, and corruption. If ever, Mr. Speaker, there was an oxymoronic statement, I believe that was it. And why do I say that, Mr. Speaker? When this government came in, Mr. Speaker, there were a number of projects and work in an advanced stage. And, Mr. Speaker, the Prime Minister who has been in government for many years, as he said, 6-star general, and also in his professional life, Mr. Speaker, knows that construction is the real engine of growth in our country, and construction can help raise your GDP, Mr. Speaker. So when the Prime Minister and his team comes in, Mr. Speaker, and they stop, Mr. Speaker, the Grosley Highway, does that not qualify as waste, Mr. Speaker? When the Prime Minister comes, Mr. Speaker, and he stops housing development, does that not consider does that not consider as waste, Mr. Speaker?
You didn't stop them?
When the Prime Minister and his team stops the most resilient and modernized hospital in Vieux-Fort, Mr. Speaker, is that not considered as waste, Mr. Speaker? When you have a good sense of humor. When the Prime Minister stops, Mr. Speaker, the work on the airport, Mr. Speaker, isn't that not waste, Mr. Speaker?
Why not? Why not?
Mr. Speaker, this concerns me because I believe, and you know what, Mr. Speaker, why I consider it waste? Because the cost is costing, the cost the country has to pay for all these stoppages. We have heard from the member, the Minister of Housing, that he has to go back to the original contractor and he had to eat his vomit, Mr. Speaker. Mr. Speaker, this thing is costing us. And maybe, Mr. Speaker, I believe the time has come. The time has come, Mr. Speaker. And I know some members of opposition will say, you were there, I just come. There's some of us there who have been 3, 4-star, 5, 6-star generals, Mr. Speaker. But the time has come, Mr. Speaker, when we need as a country to say stop this thing about stopping projects, particularly when it's worthwhile and value to the country, Mr. Speaker. We have to get to that. We have to get to that stage, Mr. Speaker. Mr. Speaker, the Prime Minister in his address goes on and he speaks, Mr. Speaker, and I've heard a few of my colleagues speak to, we have achieved the lowest level of unemployment on record, Mr. Speaker. Mr. Speaker, I would like to turn your attention, Mr. Speaker, Mr. Speaker, to page 18, Mr. Speaker, under the Economic and Social Review. But before, Mr. Speaker, the decline, Mr. Speaker, and I'm reading from my notes before I quote the page 18. Before I speak to the Social and Economic Review, I want to read from my notes. The decline in the unemployment rate from 14% in 2023 to 10.8% in 2024 is largely attributable to a reduction in labor force participation rather than a significant risk in employment, Mr. Speaker. Specifically, Mr. Speaker, 4,086 fewer individuals were counted as part of the labor force in 2024. The labor force participation rate fell from 71.6% in 2023 to 69.3% in 2024. And Mr. Speaker, I will also go to page 54 in the Social and Economic Review. But Mr. Speaker, let me read from page 18. Available data, and that's from the Economic and Social Review, Mr. Speaker. Available data show that the overall employment rate fell from 14% in 2023 to 10.8% in 2024, as the labor force decreased by 3.6% due to a lower labor force participation rate to 69.3% from 71.6% in 2023, Mr. Speaker. So when Mr. Speaker, I turn your attention also to page 54.
That's wrong.
So when, Mr. Speaker,
That's wrong. Wait.
many St. Lucians are asking, but how is the current government indicating that the unemployment rate is so low? And they're asking the questions, but where are the jobs? Where are the jobs that have been created? They've been asking it, Mr. Speaker. So, Mr. Speaker, I turn your attention to page 54. Okay? And again, Mr. Speaker, I'll also be duplicating some of the things I said here. The lower participation rate, and I repeat, Mr. Speaker, this lower participation rate was indicative of a larger number of persons opting out of participating in the labor market. Labor force participation for males and females was 76.1% and 63.1% respectively in 2024. Available data show that the number of employed persons averaged 97,354 in 2024. While there was a marginal decrease in the employed labor force in 2024, a larger reduction in the size of the labor force led to a higher employment rate and a lower unemployment rate, Mr. Speaker. I am not the one saying it. So to selectively say that the unemployment rate dropped to single digits, Mr. Speaker, is a half-truth. We have to give the full story, Mr. Speaker. So, Mr. Speaker, I will wait for your answer, Honorable Prime Minister. I will wait for your answer. So, Mr. Speaker.
That's what you said.
What is the question? Mr. Speaker, the question I want to ask, Mr. Speaker.
Not him. Are you agreeing with it? That's what it says. I'm asking the question. That's what it says.
Why are people opting out of the labor force, Mr. Speaker? Why? The question. Discouragement. Limited employment opportunities. Evolving household responsibilities. Or the or the ineffectiveness of the current minimum wage in incentivizing persons. So, Mr. Speaker, here's the question. Why are persons opting out of the labor market when the government has recently introduced a minimum wage? So everybody should be rushing. Now the people will say, I know I cannot be taken advantage of because the government has implemented a minimum wage, Mr. Speaker. So I'm going to come in that. So, Mr. Speaker, I hope you've taken into consideration the interruptions and the time that you're going to give me. Okay.
4,000 less people. Who are they? Where are they?
So, Mr. Speaker, let's move on, Mr. Speaker.
Where are they? You got the wrong Prevo. You got the wrong one. What's that? Titus? Oh, no problem. But good luck with Claudia.
Mr. Speaker.
Good luck with Claudia. But they replace you already.
On page 3, Mr. Speaker,
They replace you already.
of the Prime Minister's address.
Gone.
Lower down.
Gone. Yes.
The Prime Minister says, Mr. Speaker,
He didn't tell you?
during the
He
period,
didn't tell you what happened in Antigua?
we also improved
In Antigua.
citizen security, offered more diverse health services, and kept public debt within manageable levels. Page 3, 1, 2, third paragraph.
Done.
During this period, we also improved security. Mr. Speaker, you know who I want to answer that question?
The galaxy.
The citizens of St. Lucia.
The galaxy. Yeah, me too.
As citizens of St. Lucia, do we feel safer? Mr. Speaker, people are afraid to Lime.
Go ahead.
People are afraid to Lime, Mr. Speaker. And just yesterday or day before, I heard there was a hold-up at Capet State.
Beautiful document.
So there's no boundaries as it relates to where crime occurs, Mr. Speaker. No boundaries whatsoever. Okay? No. But I am just saying, to say that citizen security has improved so significantly, okay? That is what the Prime Minister is saying, Mr. Speaker. And that's not the case, Mr. Speaker. But, Mr. Speaker, I want to speak to Mr. Speaker. One of the first things that this government did when they came in, Mr. Speaker, was to get rid of the K9 unit. To get rid of the K9 unit. And the Prime Minister, in his list of achievements, he said that, or list of proposals, we will be augmenting the K9 unit. We augmented the K9 unit. I'm not saying that's not true. I am saying, in the first place, why was the K9 unit disbanded? Was there a specific window, that we didn't want it, Mr. Speaker? But now, Mr. Speaker, we have put it back because we recognize the benefit of it, Mr. Speaker.
It wasn't barking? Ask courts.
Mr. Speaker, the Prime Minister, in that same line, he said, offered more diverse health services. In that same line, offered more diverse health services. Mr. Speaker, do you know, since this administration came into office, more health centers have been closed? More health centers have been closed. Not as a result of mold and other reasons, Mr. Speaker. Okay? More health centers have been closed. There is an inability, Mr. Speaker, to obtain medication. Lack of beds. We all know it. I hear the stories every day, Mr. Speaker. And the Minister of Health, Mr. Speaker. The Minister of Health, Mr. Speaker, spoke in glowing terms, Mr. Speaker, of so many things. While he was speaking, Mr. Speaker, I got a message. I got a message. A lady sends me a message and she said, "Good afternoon. The minister is bragging, but I am left with a massive bill for medication which was used for my 92-year-old deceased husband at St. Jude's." That's a fact. know, you are bragging that 80-year-olds will not get bills. You say that every day. I mean, every day I'm getting people coming to me with other stories, Mr. Speaker. That's the fact.
That's the reality.
Let's not run away from the fact, Mr. Speaker.
The fiction in the house. Not the fiction in the house.
Mr. Speaker, let's move to page 4. Promises made, promises kept. A heading of one of your promises. Promises made, promises kept. Mr. Speaker. Mr. Speaker. And I have told the Prime Minister that on more than one occasion, you know. I have told the Prime Minister that we need to give credit where credit is deserved. We come, or rather, you come to the House and you boast about initiatives as if it's something that you just created. And you should know, Mr. Prime Minister, through you, Mr. Speaker, that a baby is not born overnight. A baby is not born. You know the bureaucracy within the government service, you know. And if I want to use the same analogy that a baby is born overnight, Mr. Speaker, baby has to be nurtured. You have to have medical exams. And it's the same way when you put something out there, Mr. Speaker, how it has to be taken care of. And the member for Soufriere tells you how long she's been dealing with the whole cannabis issue. You have to go through the process. So when the Prime Minister says, promises made, promises kept, and he said, we have opened 4 technical vocational educational training TVET schools. You have, yes, but give credit where credit is supposed to go, Mr. Speaker. And Mr. Speaker, I know the Minister of Education will be coming after, so he'll respond. He'll respond accordingly. But Mr. Speaker, I want to draw your attention to a newsletter from the Ministry of Education dated Friday, September 18th, 2020. And I can give you a copy of that. No, Wuda. Earlier this month, the Minister for Education, Innovation, Gender Relations and Sustainable Development, Honorable Dr. Gail Rigobert, approved a number of vocational training and certification programs prescribed by the St. Lucia Council for Technical and Vocational Education Training, SLC TVET. It goes on, Mr. Speaker. It goes on, competency standards in 9 other occupational areas as requested by the Department of Education were also developed with standards validated by the various industry advisory committees. These areas include building construction, drafting, motor vehicle engine system, general construction, manufacturing its own products, develop a new and existing business enterprise, healthcare service, dietary assistance. In signing off these programs, Honorable Dr. Gail Rigobert congratulated the St. Lucia Council for Technical and Vocational Education and Training and the Department of Education Unit for developing and launching the new National Vocational Qualification Subjects and the Caribbean Vocational Qualification Subject. In fact, Mr. Speaker, when we left office, Mr. Speaker, there was an implementation team in the ministry for TVET, Mr. Speaker. Mr. Speaker, the minister in particular and the Prime Minister, they also boast so much about first generation, Mr. Speaker, as if that was an initiative of this government, Mr. Speaker. Mr. Speaker, I go to another newsletter, March 8, 2018.
Member, just be careful how you hold the paper because you're blocking the microphone.
Okay.
And it's been not recording.
Yes, okay. You have it in your ministry. You can get it. March 8th, 2018. I can make it a document of the House if the Speaker insists. A new initiative will provide increased affordability and accessibility to education. Minister for Education, the Honorable Dr. Gail Rigobert, said government remains committed to deliver an education to every St. Lucian citizen, regardless of his or her socio-economic status. The Educate St. Lucia initiative has 8 pillars. ACT initiative, first generation initiative, knapsack drive, lifelong learning, vocational qualification, volunteerism and apprenticeship, career readiness and innovation. So when you come and you speak as if, boy, that is my brainchild, that was there. So stop coming at it that's your brainchild, Mr. Speaker. I will credit the government for seeing it through, but the government has to give credit where it's supposed to go, Mr. Speaker. Mr. Speaker, I turn your attention to page 11 on the Prime Minister's address. Page 11. The Prime Minister speaks to agriculture. Agriculture, Mr. Speaker. Mr. Speaker, I wish to you to also turn to page 113 of the Economic and Social Review. 113, Mr. Speaker. And I wish to put some statistics out there. And remember, Mr. Speaker, I am quoting from the Social and Economic Review. This is not my words, Mr. Speaker. Mr. Speaker, the last full year we had in government was 2020, Mr. Speaker. And the volume of bananas exported, the volume of bananas exports by country, tons. To the United Kingdom, we exported 4,971,300 tons to the UK, and the Caribbean region, the Caribbean region, 3,414,000.6 tons, Mr. Speaker. The year before, which is not in this, Mr. Speaker, 2019, we exported to the UK 11,622 tons, Mr. Speaker. So, Mr. Speaker, when you... No, it's tons, Mr. Speaker. Tons. 11,000. I said 11 million. Oh, sorry, 11,000. 11,000. 11,000. Thanks for the correction. Thanks for the correction. Mr. Speaker, let us compare that export, as I said, our last full year in government, to 2024, Mr. Speaker, where this government exported 7.4 tons to the UK and to the Caribbean region 2,480 tons, Mr. Speaker. In fact, Mr. Speaker, when you convert that into dollars, in 2020, from the UK, we got $9.4 million EC from the UK, and the Caribbean region, $4.3 million. And the year before, we're talking about $18.3 million in banana sales, Mr. Speaker. In 2024, Mr. Speaker, would you believe we got no money from exporting bananas to the United Kingdom? None whatsoever, Mr. Speaker. So when we talk, Mr. Speaker, about how much we've been doing for the banana industry, these are the facts, Mr. Speaker. And Mr. Speaker, I will say it in Creole. À l'année 2020, nous te voyé l'Angleterre 4,900 tonnes figues. Figues. Mais gouvernement SLPA, Mr. Speaker, yo te voyé l'année passée just 7 tonnes fig. 7. It's there in the Social and Economic Review. It's not my words, Mr. Speaker. So, Mr. Speaker, page 114. Mr. Speaker, you know, my good friend, the Minister of Agriculture, he has a heavy crown. I will not deny that he has a heavy crown to wear, Mr. Speaker. The issue, Mr. Speaker, is not all what that he's saying that he's giving to the farmers, you know, Mr. Speaker. That is necessary. But the issue is we need a reliable market. And that is why when we come here and we know we try to ridicule the whole issue of shipping bananas to France. The attempt is being made to source markets. That's at least the difference. That's the difference. We're trying to source markets. Okay? So when we make an attempt, Mr. Speaker, you come to the House and you try to ridicule it. What have you done to get new markets for the bananas, Mr. Speaker? But Mr. Speaker, we have to help the farmers. We have to help the little farmers, Mr. Speaker. And I say that, Mr. Speaker, because while the Prime Minister is out there taking out VAT on many, many items, which is commendable, Mr. Speaker, let us look at the boxes that farmers are using and also look at removing VAT on the boxes. Let us look at that as well, Mr. Speaker. We have to try to help the farmers in every way that we can, Mr. Speaker. Mr. Speaker, as I'm still on the agricultural sector, Mr. Speaker, and I was talking about market, the guaranteed market that farmers need. If you were to take a drive, and maybe you travel there today, Mr. Speaker, Mr. Prime Minister, maybe you travel on the East Coast today. Yesterday, Okviji, okay. If you travel along the East Coast today, Mr. Speaker, you will see the amount of watermelons that are being sold on our roads. A lot of them. And so, Mr. Speaker, I was so surprised at a particular supermarket. I went and I saw watermelon. It was so big. And there was a label on it. And I went closer and it said, product of Mexico. How is that happening? Where we have so much watermelons being sold on our roads and we still bring in watermelon from Mr. Speaker, you cannot eject that member from Benry. You know, how can we be saying we're supporting our farmers, Mr. Speaker, when they're hustling by the road to sell watermelons and you're bringing in watermelons? I can understand there are occasions when we don't have, and that's the kind of assessment the ministry is supposed to do. When supermarkets or anywhere come and they want to bring in items, you have to make sure that it's not available. But don't tell me we have so much watermelons and yet still we bring in watermelons from Mexico. Mr. Speaker, we need to look at that. We need to look at Mr. Mr. Speaker, an area that is very close to my heart, Mr. Speaker, because I like water.
I think he's taking his leave. Sorry, not to eject.
I like water, Mr. Speaker. And the Prime Minister spoke to water, Mr. Speaker. Wasco, page 25 in his address. Mr. Speaker, the government of St. Lucia is determined to take measures to solve the issue of an unreliable water supply in some parts of the island. Mr. Speaker, isn't it passing strange that the Prime Minister at this 4th year in office is making that statement, Mr. Speaker? Mr. Speaker, if you want to compare what has been done for the water sector, Mr. under different administrations is chalk and cheese. The past administration, Mr. Speaker, run northern pipelines. We completed the Denry project. 2 treatment plants in Vieux Fort, Mr. Speaker, one in Beauséjour and one in Greece. We built the administrative building for Wasco, Mr. Speaker, and several holding tanks all over the place, Mr. Speaker, was an initiative of the last administration, Mr. Speaker. Mr. Speaker, the Prime Minister spoke to,
right? According to you,
4 recommendations that were made by the World Bank with regards to water. He said the World Bank recommended expanding wastewater and sanitation services, improving efficiencies of water services and augmenting Wasco systems, resources and capacity, water security, and an enabling environment for private capital mobilization. Well, that particular one, you know, we've been there before. So we need to approach that one very, very carefully, Mr. Speaker. But, Mr. Speaker, the Prime Minister went on to say, Mr. Speaker, the World Bank's assessment clearly indicates that the EC 59 million desilting exercised by the former administration did not serve the intended purpose, Mr. Speaker. Now, Mr. Speaker, I will not spend too much time on that because I believe that a lot of information has gone out with regards to this whole WASCO issue already, Mr. Speaker. But here are the facts, Mr. Speaker. Desilting started in 2020 under the UWP administration. And if you want accurate information, WASCO has it, the NERC has it, CDB has it. You can go to any one of these areas and you can get the information, Mr. Speaker. And, Mr. Speaker, the facts have spoken that the dam was heavily silted as a result of in particular free incidents, disaster incident. Tropical Storm Debbie in 1994, Hurricane Thomas in 2011, and the Christmas Eve trough in 2013. Mr. Speaker, the dam has a capacity of 700 million cubic, is that what it is? Gallons, yes. 700 million gallons. But silt, Mr. Speaker, has actually displaced 400 million gallons. So where we had 700 million gallons, we only have 300 million gallons of water now in the dam.
Mr. Speaker.
Member of Castries office.
Mr. Speaker, I rise on 42.6 rules of debate. The member made reference to water tanks being the part of the administration, and I did speak. I spoke in my presentation to a water tank being built in Strozel. I need to state that this water tank of 100,000 gallons that was recently commissioned was a project conceptualized in 2016 under the Labour Party administration, and the BNTF project cycle takes approximately 5 years. So the column bed water project, water tank of 100 gallons, and the water project that you just commissioned are projects under this administration.
Mr. Speaker, I challenge the member, okay, to go and look at who made the request for the BNTF, under that BNTF for that tank in Choiseul. Who made it? That was made under our administration, Mr. Speaker. And let me tell you something. When you see I speak, I will speak. Okay? And I will bring documentation, Mr. Speaker, next time we have a sitting of the House, and you will apologize. And you'll apologize, okay? Okay. So, Mr. Speaker, we'll move on. I said, Mr. Speaker, silt displaced 400 million gallons. Mr. Speaker, the studies show that the amount of silt that was in the dam is 1.5 million cubic meters of silt, Mr. Speaker. And the expert indicated it would have taken us 10 years to clear that. The work that was done, Mr. Speaker, was only 1 year work. 1 year work. It cost us $20 million or $22 million to build a disposal pit, and the balance was to do the desilting, Mr. Speaker. Now, obviously, I believe any government would put their hand on their head and say, boy, that's a lot of money to continue spending to desilt. So, obviously, it's a nightmare, Mr. Speaker. But this government did not continue any desilting at all, Mr. Speaker. And God forbid we have any major incident, any major disaster, Mr. Speaker. And I've always said maybe the whole issue of WASCO is not sexy enough, Mr. Speaker. But God forbid we have another incident and our level of water in that dam is significantly reduced.
Member
again, Mr. Speaker.
Cecil, I don't mean to interrupt you, but the section you quoted and what you're saying there's no connection. You quoted what he said, the World Bank said.
Yeah, no, Mr. Speaker.
But you're not disputing that.
Mr. Speaker, what he was saying, what the Prime Minister said, is that he said whatever desilting we did not serve the intended purpose.
He said the World Bank said that.
Yes.
So you're disputing that.
I am disputing, Mr. What I am saying, the statement that he made, Mr. Speaker, it could lead to various suggestions, Mr. Speaker, and I wanted to clarify the whole issue. Okay? So, Mr. Speaker, I believe that while the Prime Minister must be commended for the whole, the lines that you want to bring in, the raw water lines, Mr. Speaker, that's commendable, but it should be done hand in hand with a continuous desiltation project, Mr. Speaker, because we could have a major problem on our hands, Mr. Speaker. Mr. Speaker, my good friend, Equity and Social Transformation. Mr. Speaker, I turn your attention to page 57 of the Prime Minister's address. Page 57, Mr. Speaker. I will read the second line under equity and social transformation. It says, this year, the ministry's allocation was increased by EC 4.5 million from 20 million to EC 24.5 million. Kudos to that, Mr. Speaker. I don't have a problem with that. The problem I have, Mr. Speaker, is that hundreds of people were taken out from the public assistance program, Mr. Speaker. Hundreds of people were taken out from the public assistance program. Now, Mr. Speaker, I cannot verify how much of an in-depth analysis that was done by the ministry to determine who should stay on and who should come out. I cannot. But, Mr. Speaker, this is what I know. This is what I know, Mr. Speaker. What I know is that I have interacted with a number of victims of this, Mr. Speaker. And only last week, Mr. Speaker, I met a wheelchair-borne individual who told me she is leaving it in God's hands.
Member for Cash's office.
Thank you very much. Again, Mr. Speaker, I rise on the Standing Orders 32.6 rules of debate, and I need to clarify this, which that
Yeah, but make the point, don't give a speech.
Thank you. Mr. Speaker, the assessment of everyone on public assistance was done on the SLNet 3.0. Persons were scored in 4 categories. Category 1.
Remember, but don't you want to rise after his presentation to clarify that? Because you're going to be limited in what you say now, but you can rise later on after his presentation to make a full explanation.
So guided, but I do not want it to continue to mislead the public, Mr. Speaker, and that's my fear.
Mr. Speaker, I'm not misleading. I'm stating the facts, Mr. Speaker, that there are people who were taken out on the public assistance program, Mr. Speaker, and I am not sure what sort of analysis was done. And Mr. Speaker, you see, Mr. Speaker, let me tell you something, Mr. Speaker. Mr. Speaker, there are many of our senior citizens who at one point in their life, they worked very hard. However, Mr. Speaker, they made no nest egg. They have no nest egg. So they may have a house. They may have a house. You may go and see them and they have a house, Mr. Speaker, but they're not working. They have no income. I have gone overseas, Mr. Speaker, and family members give me a little $100 US, tell me, give that to, share that to different family members. That's not doing anything. And when the ministry looks and says, but your daughter is working or your son is working, they're supposed to, people want their independence, Mr. Speaker. The people have their own commitments, Mr. Speaker. And the other thing too, Mr. Speaker, you know what I have found out? Depending on the Nenen on power, you have, they reinstate you. And I know that for a fact. I know it for a fact. I will not mention names because it's very sensitive to the House, in particular one of them in particular in this House. Okay? I will not mention it, but I can speak to you privately, Mr. Speaker. But, Mr. Speaker, what I am saying is if there's an increase in allocation, Mr. Speaker, and I can tell you something, the three people that I have interacted with regards to the public assistance, and I know there's about 700 people that were removed from this program, okay? But the three people, not in Roselle, I'm talking about island-wide. Okay, well, you'll clarify. The three people I have interacted with, Mr. Speaker, you know they are all differently able. They're all differently able, Mr. Speaker, and it hurts me. It hurts me, Mr. Speaker, not because the person have a little house, they can't even well pay their current, they can't pay the electricity, Mr. Speaker. So we have to look at that again. We have to do that. You know, Mr. Speaker, there was a conversation we had, you and I had, many years ago. You know what you told me? We must never dehumanize the vulnerable. You told me so. That's your words. So now, what happened? What happened? You remember that conversation? Okay. So, Mr. Speaker, I really wish for so that you know, this thing can be revisited, Mr. Speaker. Mr. Speaker, I want to comment briefly on the member for Soufriere Hospital on her contribution. I thought she made a very good contribution, Mr. Speaker. I will say that with regards to the work being done by the ministry. She did. But, Mr. Speaker, there are a couple of things I would like to raise to your attention, Mr. Speaker. There's always a but. Regarding the Bureau of Standards, Mr. Speaker, and when I was in the ministry, it was one of the things that we were looking at. there should be no product coming into St. Lucia where we cannot read the label. And that is still happening. And we need to look at that. There should be no product coming to St. Lucia where we cannot see what we are consuming, what we are using. And the Bureau of Standards need to be more active with regards to that, Mr. Speaker. The member spoke to the Love St. Lucia campaign, Mr. Speaker, and it's a campaign that was started when I was in the ministry, Mr. Speaker. And I want to support her that we need to encourage all St. Lucians. And I want to speak to the Minister for Tourism, Mr. Speaker. Mr. Speaker, we give significant incentives to the large hotels. Lots of incentives. And we started the conversation, but I'm not sure where it's now. But we need to ensure, for example, these hotels buy local arts to put on their walls, buy local products to put in there. We need to do that. We're giving them too much, and they cannot support. They bring in everything in bulk from China or wherever bringing it. We need to ensure that there's something in that clause that we put in with regards to the incentives, that a certain portion of what you're purchasing has to be local. And I hope it's not one of the we don't go into the situation where we have with the chickens. We know what goes on with the chicken situation. Mr. Speaker, Mr. Speaker, I want to speak to an observation I made in the estimates of revenue and expenditure, Mr. And I turn your attention, Mr. Speaker, to page 927, where we discuss grants and contributions to various entities. Mr. Speaker, I notice that we are given $1,814,000.
Member, while I will allow you to proceed, you are aware this is the policy debate, and that the debate on the estimates...
It comes back to that, Mr. Speaker.
But the debate on the estimates is over. But I will allow you some latitude.
I'm reference to this to come back to the policy, Mr. Speaker. Mr. Speaker, $1,814,300 paid to the St. Lucia National Lotteries, Mr. Speaker. Now, Mr. Speaker, why I bring that up, Mr. Speaker?
Always be careful.
Why I bring that up, Mr. Speaker? Because, Mr. Speaker,
That's the only person that's
the St. Lucia National Lottery
stop threatening people.
took a loan of $80 million guaranteed by the government to improve sporting facilities around the island, Mr. Speaker.
Honestly.
Mr. Speaker,
Honestly.
it tells me that if the national lotteries have the capacity to take an $80 million loan where they have to pay almost $800,000, Mr. Speaker, a month, or $7.14 million annually, why is the government giving national lotteries a grant? And I'm hoping the minister will speak to that tomorrow. I'm really hoping the minister will speak to that tomorrow, Mr. Speaker. So it's just an observation, and I'm hoping that...
You have 10 minutes left, member.
10 minutes? Mr. Speaker, you cut a lot of my time there.
Much more time.
Half an hour. Yeah. Yeah. I wouldn't go.
Leader of Government Business.
Mr. Speaker, I wish to move a motion to suspend Standing Order 32-8 to allow the member from Strozel, Saltibus, to have an additional 15 minutes to complete his presentation.
Honourable members, the question is that Standing Order 32-8 be suspended and Standing Order 32-10 be invoked to allow the member for Strozel Saltibus an additional 15 minutes in which to conclude his presentation. And now for the question, as many as of that opinion say aye. Aye. As many as of a contrary opinion say no. I think the ayes have it. The ayes have it. Please proceed.
Thank you, colleagues. Mr. Speaker, I did tell you I have a lot to say. So, Mr. Speaker, considering how time flies, I will have to jump forward, Mr. Speaker, and speak to maybe some of the things I believe are critical in terms of bringing to the Prime Minister's attention, Mr. Speaker. Mr. Speaker, the Prime Minister, in his list of proposals, Mr. Speaker, there are three things he mentioned, Mr. Speaker, that concerns me. One Effective 1st July, NIC will increase pension payments in line with consumer price index. I don't have a problem with that. Police, fire, and correctional officers who have served at least 20 years and reached the age of 55 will qualify for an NIC pension. No problem with that, Mr. Speaker, although, there's a lot I can say about that. And also, Mr. Speaker, I think it was it last year or earlier this year, there was another NIC increased the minimum pension to $500. So, Mr. Speaker, why am I raising that, Mr. Speaker? And I'm not sure, I was joking with the member for Soufriere. I said, member, as a former head of NIC, I'm not sure whether the Prime Minister had discussions with you before a lot of these things. Because about 15 years ago, Mr. Speaker, in another place, I remember having conversations with the actuaries of NIC. And one of the things they said to us was, unless something changes, NIC's longevity will go on. We don't have much to go. I think the date they said was 2049 or 2050 or something like that. Yeah, Mr. Speaker. So the options they have, No, they came to a meeting, Mr. Speaker. In fact, okay. The member said they didn't tell me that. Yeah, okay. But we had a meeting to discuss it. But Mr. Speaker. Yeah, okay. So, Mr. You were at that meeting too? So, no, but Mr. Speaker, it's important, and it's very important what I'm about to say. So, Mr. Speaker, in fact, Mr. Speaker, the 2024 Article 4 report from the IMF also spoke to the national insurance is on a trajectory towards insolvency by 2051. Why am I raising that? 2051. Why am I raising that, Mr. Speaker? I'll tell you why I'm raising that, Mr. Speaker. Because, as I said, they have options. You increase the age, you increase the contribution, and there's a third one. You make sound investments. Okay? So this is why I'm saying sometimes we play politics, Mr. Speaker, for no reason. Because when NIC borrowed Cabot monies, Mr. Speaker, and the political surrogates and everybody, Mr. Speaker, made so much fuss about lending, but that was a sound investment. Mr. Speaker, Cabot was so concerned. They closed the loan in 2 years. You know how much NIC got for that 2 years? $2.4 million. $2.4 million for 2 years. Had that loan gone to the length of the original facility, they would have made $12 million easy. And these are the kind of investments we need to supplement the NIC. So we need to stop these political things when it comes to some of our state institutions, because we know better. And I know you know better, Mr. Prime Minister, because that's your field. That's your field. You know these things. So, Mr. Speaker, I wanted to raise that because I'm very concerned as it relates, Mr. Speaker, to, I'm happy. Fundamentally, I'm happy to the people who's going to benefit, Mr. Speaker. But I'm saying there must be a conversation as to now what's going to happen with NIC. Now, are we expecting to see an age increase in the future? I don't know, because there's no information on that, Mr. Speaker. Mr. Speaker, when I say that the government did some searching and they, explored some of the things that we were talking about, one of the things I'm talking about, Mr. Speaker, the Prime Minister in his policy proposal said, effective 1st May, the price of fuel will be capped at $16, Mr. Speaker. Mr. Speaker, today, Mr. Speaker, a price of a barrel is $63. In 2019, Mr. Speaker, 2019, a price of a barrel was $75. And we had capped fuel at $13.95 in 2019 when a barrel of fuel costs $75. Today, it is $63, and the Prime Minister has decided to cap $16. Not even $1 you take out, Mr. Speaker. Not even $1, Mr. Speaker. 50 cents. 50 cents. So I'm really hoping the Prime Minister rethinks that, because when that fuel price was going on, we are looking for a bigger drop in that, Mr. Speaker. So I want you to come again with that, Mr. Speaker. I'm very happy, Mr. Speaker, that the Prime Minister has realized the pain that he caused the middle class with regards to the new tax structure. I'm very happy because I can tell you, Mr. Speaker, people would come to me and tell me, you know, I never had to pay inland revenue when I file, and they had to pay inland revenue this year, thousands of dollars, Mr. Speaker. Thousands of dollars. I'm a victim. I'm a victim. I'm a victim, Mr. Speaker. So, Mr. Speaker, I want to advise, Mr. Speaker, that the government still looks into this, Mr. Speaker, and provide additional support, Mr. Speaker. Because you will all remember, Mr. Speaker, in your last manifesto, you promised $48,000 would have been the cap. It's a promise not kept. A promise not kept, Mr. Speaker. So are these just promises that will not be kept? We have to look at these things, Mr. Speaker. You know, Mr. Speaker. There's also, Mr. Speaker, where the Prime Minister indicated that people who are established as government employees who are daily paid or classified as wage earners will be given permanent employment after 2 years, Mr. Speaker. As far as I'm aware, under the Labour Code, if your contract is applied, if it's broken then, but if your contract is renewed for 2 consecutive terms, you become permanent, Mr. Speaker. So I don't know, that's just something to make people. Mr. Speaker, you'll correct me. Yeah. Mr. Speaker, so that's a wish list, Mr. Speaker, because I was very surprised that the member for Soufriere was not so elated, Mr. Speaker, with the senior citizens home that was going to come to Soufriere. You know, she should have been jumping high and low time. You know, I didn't hate her. She had to say it for the whole world to her, Mr. Speaker. You know, and Mr. Speaker, we know, Mr. Speaker, the Soufriere administrative building, Mr. Speaker, as well. That's something that we, Mr. Speaker, conceptualized under our last administration, but we lost the elections, Mr. Speaker. Mr. Speaker, the Prime Minister also spoke about period poverty. And that's a good initiative. But you know my concern? This is my concern, Mr. Speaker. How is it going to be run? And I really wish, we can come to that at point. Because, and I'll tell you why. You see the dignity that can happen if this thing is not run properly? That's my concern. Because I know for a fact the amount of bullying that goes on in schools, Mr. Speaker. Bullying that goes on in schools. And if some of these things are not properly managed, the child can be a victim. And I'm very concerned. Should it be the Ministry of Education? Can it not be the Ministry of Social and Equity? I don't know. I'm just saying there should be a lot more discussion because I'm really concerned about how it's going to be run. Is it the consulate who's going to be in charge? Who's going to know that a child cannot, afford, yeah. So I wanted to raise that, Mr. Speaker. Mr. Speaker, I'm going through very fast because time is flying, Mr. Speaker. Mr. Speaker, the government also wishes to pay CSC subjects, 2 more CXC subjects, Mr. Speaker. I can be vexed with that. Mr. Speaker, but, Mr. Speaker, there is a but, Mr. Speaker. I have a problem in the government paying 2 extra CXC subjects for the member for Castries Southeast. They can afford it. Southeast, whichever. He can afford it, Mr. Speaker. And I believe, Mr. Speaker, at this time, we really look at who really requires this thing, Mr. Speaker. Okay? No. They are vulnerable. Let me tell you, know why I'm telling you that? Listen to why I'm telling you that, Mr. Speaker. Mr. Speaker, in my constituency, there are parents who cannot pay no subjects. No subjects. Okay?
They should get more.
So I am saying you have to identify these children who cannot pay any, Mr. Speaker, and increase.
4 is not enough.
Mr. Speaker, I go on to Mr. Speaker. It's amazing, when we on this side speak, the amount of interruptions. When you're speaking, I make sure I listen attentively, attentively, Mr. Speaker. It's not right. You know, I mean, fortunately, there's one member that's not there, but, you know, you have made it even worse, you know. But, Mr. Speaker, there's one, Mr. Speaker, which I am also concerned about, and that the Prime Minister spoke to removing the taxes on goods that are controlled. I think it was price control goods, Mr. Speaker. Here's the concern I have, Mr. Speaker. The Prime Minister should know, and if he does not know, the member for Soufriere, Minister of Commerce, can advise him. You cannot do that unilaterally, okay? Based on the Treaty of Chaguaramas, Mr. Speaker, this must be approved by quoted, particularly if the goods are produced within the region. If the goods are produced within the region, and in your note you mentioned cornflakes. So if cornflakes is produced in Trinidad and you want to bring cornflakes from America, you cannot take out the duties on the cornflakes from America because Trinidad will have a problem with it. Income duty, 0.5. Okay. I'm not sure. Okay. Yeah. Okay. So, Mr. Speaker. That's the case. He took it out before. So, Mr. Speaker, let me quickly address some issues in my community, Mr. Speaker. Mr. Speaker, during my time in office in government, there are a number of land acquisitions that were made, Mr. Speaker. Land were acquired in La Pointe, Delse. Did the member for Denry say I said that last time? Right, we can. La Pointe, Delse, Monsignor, Newfield, and Lafargue, Mr. Speaker. And the reasons, Mr. Speaker, a number of them was to regularize housing, as has been spoken about there with regards to giving people title, Mr. Speaker. And it's something that we did, Mr. Speaker, for several people while we were in office. Some of them was also, there have been lands that have been identified as plain fields for so long, and they were never acquired, Mr. Speaker. So that was done. Green spaces was one of the reasons why we also acquired some property. Various economic activity, Mr. Speaker, and also to preserve our patrimony, Mr. Speaker. And by now you know that I acquired the 2 sugar mills in Choiseul for that, and also there were major plans as to what we would have done there, Mr. Speaker. Mr. Speaker, I have not heard anything from this government, and I feel, you know, the government needs to recognize every single community when it comes to, Mr. Speaker, doing things for the communities. And Choiseul Saltibus should not be left out. The member for Ancillary Canneries promised me in his next contribution, he will tell me why the HRDC were not open in PI and in Roblo. Because this morning I paid close attention when the member for Casheries South was speaking, and he said the importance of these facilities. And a lot of us have spoken about the importance of these facilities. The member for Grosile said he opening one just now. And it is not me. That's been, the people are waiting for that, Mr. Speaker, and we should not be, and Blasha also has one that has not been opened, Mr. Speaker. And these things have been lying there for over a year, Mr. Speaker. We must put an end to that thing. The people need their community centers, Mr. Speaker. The Minister of Infrastructure is not there, but I hope he gets the message, Mr. Speaker. I have raised to his attention that there are 2 communities that require Bailey bridges urgently, and that is Daba and Café, Mr. Speaker. The Bailey bridges, they have said they have that in abundance, Mr. Speaker. We had a discussion up to a day like today, nothing, Mr. Speaker. I'm hearing roads being built all over the place. I'm seeing list of roads, Mr. Speaker. I would like to indicate some of the roads that I believe in Choiseul should be given some attention and priority, Mr. Speaker. Okay? And Mr. Speaker, many of these roads have been spoken to. In fact, the Ministry of Infrastructure sent a note as to some of the roads I would like to make priorities, which I did, Mr. Speaker, 3 years ago, and nothing has been done. The Dibrel to Montet Road, which is a ring road that can be used in the event there's obstruction of traffic on the main highway, Mr. Speaker. The Montgouche-Lewish Road, Mr. Speaker. Boaden, we require crash barriers in Daba, Mr. Speaker. The Opak Road, Mr. Speaker, they have been promising to finish it, Mr. Speaker. The Monjack Road, Mr. Speaker, I would really want, Mr. Speaker, that this thing is addressed, Mr. Speaker. Mr. Speaker, I want 2 more points before I close, Mr. Speaker. There's something that concerns me very much, Mr. Speaker, and that is, before we demitted office, Mr. Speaker, we had started what is called a bungalow farming village. We identified 20 acres of land, Mr. Speaker, and it was really and truly to empower young people, in particular women, in agriculture, Mr. Speaker. Approximately 20 acres of land was identified. We, in bungalow in Choiseul, Invest and Lucia invested $200,000 in infrastructure. They bought pipes, they bought a major pump station for us. We built a pump station, Mr. Speaker. This government has come in, Mr. Speaker, and there has been no push on this, Mr. Speaker. In fact, Mr. Speaker, I'm hearing that the Minister of Housing wants to take over that land for another purpose, Mr. Speaker. Mr. Speaker, in this modern age, Mr. Speaker, mechanized farming is the way to go, and that's flat, maybe the most fertile land in Choiseul. I would like the government to rethink whatever plans they have for that area and to make sure that we leave this area for farming, Mr. Speaker. Mr. Speaker, the Minister for Investment also, when he came in, he would have found a program in place called Boost, Mr. Speaker, the Boost program. And Mr. Speaker, the Boost program, Mr. Speaker, I believe when the member came in, he realized how good this program was, and he said to the Prime Minister, here's your youth economy, and he just passed it on. Because this Boost program was set up to create real entrepreneurs, Mr. Speaker. Young entrepreneurs enrolled in the program will be provided with comprehensive training and ongoing support in corporate governance, accounting, financial management, marketing and general administration, and operations. Every entrepreneur would be assigned a mentor carefully selected from a pool of very successful St. Lucians skilled in various areas. To add to that, Mr. Speaker, we had the grant loan facility at SLDB to support that, Mr. Speaker. There was an ecosystem that was created. That was a wonderful program, Mr. Speaker. Now, I understand you may have just changed the name, Mr. Speaker, you know, but...
Just like community tourism. Where was that?
You know, the member said he didn't. Well, you need to speak to the people in your ministry, Mr. Speaker.
Kill it.
Mr. Speaker, I would really also want the member for Grosley, Minister of Sports, to speak to why Choiseul has not received the batting nets, Mr. Speaker. That was promised by himself, Mr. Speaker. I hope he speak to that. I hope he speak to that. I hope he speak. The batting. Mr. Speaker. Mr. Speaker, I just want to ask the Prime Minister one more thing before I leave, Mr. Speaker. The Easter passed, and we realized there was no STEP program, Mr. Speaker. And I don't know if you're looking to have a major STEP program very soon, Mr. Speaker. And I'm really hoping, because our roads, Mr. Speaker, we talk about that, yeah. But stop giving me pittance, sir. Stop giving me pittance to clean the road, because it's not me. This show. Stop giving. Mr. Speaker. Mr. Speaker, I really hope that the contribution I made here would have made the Prime Minister and the team rethink some of the things that they had in the policy proposals, Mr. Speaker, because I really believe some of these things were just put out there, Mr. Speaker, to glamorize an address, Mr. Speaker. But as to the practicality, whether there's consultation, I'm very concerned about that, Mr. Speaker. So, Mr. Speaker, with that, Mr. Speaker, I wish to say good evening and thank you very much.
I want to answer.
I have cricket.
Mr. Speaker, I want to answer.
Member for Castries Southeast.
Thank you very much.
You're rising on the standing order 32.6.
On the standing order 32.6.
Okay.
Mr. Speaker, the member indicated that 700 persons were removed from public assistance. That's absolutely untrue. Incorrect. Incorrect. None. There's a recertification of the beneficiaries every 2 cycles. We do twice a year. In 2024, we indicated that 700 persons scored 3, meaning that they are non-poor, but they are still on the program. I will explain to you, members, that there are...
Remember, you're not going to give another speech, right?
No, I'm not giving another speech. There's also a review process to ensure that persons who are receiving monies actually are the ones receiving monies. We do a recertification because sometimes there's a death in a family and the person would have changed. We do that, and we ask persons to submit information to ensure that the persons that are there to receive the monies are the ones receiving the monies. So there have been instances where we do that, but everyone who has been on the program still on the program. No, there are times that we stop to have persons to conform because we believe that there are instances where we believe that the persons who are supposed to be receiving the funds they're not the ones receiving it. But everyone that has been certified, recertified, they are still on the program. So you are absolutely incorrect on this one, sir.
Members, the two of you could just have a little discussion.
No, but,
just like,
but
we are debating
but
the
if the members
appropriation
made a
bill.
statement to the public and it's incorrect, from Mr. Speaker, if a statement is made in this house and it's incorrect, I think on the point
Well,
of principle, we need to correct
I understand that, member, but the two of you can have a sidebar in the middle of an appropriation
Well, yes,
bill.
that's not a sidebar. He needs to.
But,
I need to say it through the speaker that it is incorrect, and the member should
The
subscribe.
member has requested unofficially some
Yeah.
figures so you and him can have a discussion.
Yeah, but we need to establish that the information he provided to the general public is incorrect.
Well, all you have done is say something different to what he said. You haven't proved anything yet.
Well, I have, as minister responsible for this, and I can come with to substantiate that on another time.
That's what I'm saying. I mean, the
Yes.
fact that you're the minister and you
Yeah,
said
but-
that doesn't make it correct.
Well, I'm saying that what is submitted is incorrect.
I accept that, but I'm saying
Thank
that's just, in my books, you have not disproved what he has said. You have said, you've simply given an explanation.
Well, I will provide.
So you provide, exactly.
I will provide additional information, Mr. Speaker.
Fair enough. Does that satisfy you, member for Swizzle? No, I've asked him to, yeah, okay.
Thank you.
Thank you. The member for Dennery North.
Thank you, Mr. Speaker. Mr. Speaker, I rise in support of the appropriation bill as presented by the Honorable Prime Minister last Tuesday in this Honorable House. Mr. Speaker, it has become routine for me after 3 successive election victories to rise in this House to contribute to budget debates. I have supported budget addresses, Mr. Speaker, from the perspective of being in government, and I have vehemently opposed policy pronouncements which at the time of their unveiling, I believe, were not in the best interest of the people of St. Lucia, and more specifically, the people of Dennery North, on whose volition I qualify for a seat in this August Assembly. And so, Mr. Speaker, I am duty-bound to once again place on the parliamentary record my heartfelt gratitude to the people of Olean, Despin, Gadet, La Pelle, Larissos, Richfond, Grand Ravine, Grand Riviere, Belmont, and Dennery Riviere, my constituents of Dennery North, for their unwavering love and support throughout this journey. Mr. Speaker, in the majority, they have pledged further support for Sean Edward and the St. Lucia Labour Party whenever the next general election is called. Mr. Speaker, but before I proceed any further, I crave your indulgence to express condolences to families in Dennery North that have lost loved ones in recent times. Mr. Speaker, I want to reach out in a very special way to my dear friend Curtis of Dennery Riviere, who lost his soulmate and dear wife, Donisha. She passed away at the St. Jude Hospital earlier this week. Mr. Speaker, this morning I received news that Levy Harper of Dennery Riviere passed away, and so I want to express condolences to his family. I also want to express my condolences to the Mulway family, who yesterday had to bid farewell to their matriarch, Mr. Bell. And Mr. Speaker, all the other families in Dennery North would have lost loved ones in recent times. I want to also reach out to the Deputy Secretary General of the CARICOM, Mr. Armstrong Alexis, and his family on the passing of their mother. Mr. Speaker, before I delve further into my presentation, Mr. Speaker, I don't know if it is fate, coincidence, or by design that more often than not, I get to speak after the member for Choiseul, Saltibus. But Mr. Speaker, I would rather speak after the leader of the opposition, because convention in St. Lucia and elsewhere in the Caribbean dictate that after the Prime Minister has presented the budget address, it is the responsibility of the opposition leader to provide an immediate response. Mr. Speaker, this is what happens in Trinidad and Tobago. This is what happens in Barbados. This is what happens in Jamaica, St. Kitts, and throughout the Caribbean. But in St. Lucia, for reasons unknown to me, the leader of the opposition refuses to honor and respect the convention, and instead, Mr. Speaker, he refuses to respond to the budget address when the entire nation anticipates a response and alternatives to what the Prime Minister would have presented. And so today I find myself speaking not after him, but instead after the member for Choiseul. And Mr. Speaker, I wonder if the member for Choiseul is being set up. I wonder if there's a complot, Mr. Speaker, to send the member for Choiseul up front to take, for want of a better expression, the blows, Mr. Speaker, that he constantly subjects himself to with his utterances in this honorable House. And you would have thought, Mr. Speaker, that given what happened in the debate on the estimates, that the member would have learned his lesson and come here and make a more informed contribution to the debate than some of what, Mr. Speaker, he was spewing there with the confidence of a man who's lost, Mr. Speaker, and does not even know whether he is coming or is going in this House. Mr. Speaker, the member chided our government, according to him, for stopping the Groseley Highway and stopping the hospital in Vieux-Fort. Because according to him, and he may be right, Mr. Speaker, about construction's contribution to economic growth. But if you go into conveniently cite the Groseley Highway and the St. Jude Hospital, you should have, in the same vein, cited your government stopping of the administrative building in Vieux-Fort. He did not cite that his government stopped the Larry Social Center, the Labrie Market, the Bassett Joseph Community Center, and so many other projects they found in train when they came in, Mr. Speaker. But because of political victimization and because of them not having an affinity for ordinary people, they decided to stop the project, believing that that would have inflicted pain on the parliamentary representatives in the communities that the projects had already been earmarked for. And so, Mr. Speaker, he wants to chide us because, according to him, we stopped the highway in Groseley and the hospital. Mr. Speaker, he has a problem. He has a difficulty. He has a discomfort with the lowest unemployment figures ever recorded in this country. And he could not sit there and accept that our government has performed. And we have taken unemployment down to an unprecedented low. Never before in the history of this country have we recorded, Mr. Speaker, such brilliant figures as it relates to unemployment. Mr. Speaker, he wanted to take credit for the TVET program in the Ministry of Education. Mr. Speaker, and he comes with an outdated press release trying to claim the successes that are being reaped, Mr. Speaker, with our TVET program in the Ministry of Education. Mr. Speaker, he has a difficulty with the fact that this first generation scholarship program is yielding success and providing opportunities to ordinary St. Lucians who otherwise, Mr. Speaker, would not have had the means to walk the halls of a university in pursuit of higher education. Mr. Speaker, you would have heard the Prime Minister before talk about there's been an administration of Wooder, Schroeder, and Wooder. They wasted 5 years in government, and that was not enough time to waste. They still went into a 6-year wasting time, have nothing to show by way of achievements for their tenure in office, and today you want to come 4 years in opposition to come and claim TVET project and successes in TVET. You want to lay claim to the first generation scholarship program. Mr. Speaker, they were the ones, when they came in, and I've said this in this house and I will repeat it at every sitting if I have to, so that the point can resonate. The member for Labrie at an OAS meeting in 2012 in Guatemala, he engaged his foreign affairs counterpart for the Denmark of Water Redevelopment Project, and he was able to secure a grant of $5 million. Upon realizing that the $5 million from Mexico would not have been sufficient for the Denmark of Water Redevelopment Project, our government, the St. Lucia Labour Party, under Dr. Kenny Anthony, we secured an additional $22 million from the Caribbean Development Bank for that water project, Mr. Speaker. And who had the scissors in hand when the project was completed and I was in opposition? The member for Beaufort South, because election was approaching. He had Micoud South, Mr. Speaker. He had the scissors cutting the ribbon to celebrate a project that he claimed as his, because he had nothing to show by way of successes during his tenure in government. And today, Mr. Speaker, the member for Choiseul Saltibus will come here.
Member for Micoud South.
Mr. Speaker, on a point of order, the member is misleading the House. On that specific date, he was invited, he was in attendance, and he was given a keynote speech, and every single speech that a member from my government made acknowledged the work that the Minister of Foreign Affairs, the previous Minister of Foreign Affairs, had done, and also the Minister. And the government never took credit for starting the project, but was very happy to complete the project, but gave full credit to the genesis of the project, and specifically the Minister of Foreign Affairs, and also the district rep at the time. Thank you, Mr. Speaker.
Thank you.
Mr. Speaker, I'm continuing. I am not withdrawing the statement. I will repeat what I said. I said, Mr. Speaker, that he took credit for the project. He had the scissors cutting the ribbon on the day when the project, Mr. Speaker, was officially opened. And if you, Mr. Speaker, for you, Mr. Speaker, if he can bring his manifesto on his list of achievements on the eve of the last general election, he had checked next to that particular project a success of the United Workers' Party. So don't come here today and want to claim credit for TVET program and first generation scholarship program. Don't. That was not your work. You wasted time. You had nothing to, you were too busy telling St. Lucians that you would have provided visa-free access to the United States for them. You promised that you were going to send bananas to France. That is what you told St. Lucians. And you were very specific with your pronouncements. You said there were documents on your desk awaiting your signature, so that days after you assumed the office as the government, bananas would be leaving St. Lucia to go to France. You know what I saw in my constituency? A banana producing constituency. People who had left St. Lucia to work in Martinique and come back after 15 days. They returned, Mr. Speaker. They cleared lands and they began to cultivate bananas again because they had been promised a market in France. And Mr. Speaker, 5 years, dragged into a 6th year, not a single bunch of bananas could have left the shores of St. Lucia to go to France. But today you come and you want to claim success in relation to TVET program and first generation scholarship program. You promised 23 islands, but you wouldn't complete the Larry Sozelf Center. You promised 26 islands, you wouldn't complete the Austin Hill Road. But today, had a member for Choiseul. He comes and he talks about roads in his constituency. He talks about centers in his constituency that have not been opened. As I said in the debate on the estimates, Mr. Speaker, if there are facilities waiting to be opened in his constituency or any constituency for that matter, this government will ensure that the facility will be opened. But you see, the worst thing is when you sit at meetings, Mr. Speaker, where you are being programmed and you are being instructed by people who themselves are not brave enough to even put their name on a ballot to contest elections. But they come as caucus advisors and they ask you to go up front and say this in the parliament. And that is why I said a while ago, and I will repeat, that I believe the member is being set up. The member is being set up. That is the departure from convention. Tout partout à Kawaïbla, les unis en premier ministre qui venu et puis qui mette speech budget leader. Premier monde qui s'y posait parler, c'est leader of opposition. Il a fait à Trinidad, il a fait à Barbade. Il a fait à Jamaica, il a fait à St. Kitts. Mais à cette liste, Même Parlement pour Mikoud South, c'est seul monde qui a décidé qu'il n'y a pas qu'à venir parler, là, il osé parler, et qu'il n'y peut parler, là, il veut parler, et planer en l'autre 16 personnes dans le Parlement qui n'y peut coûter, là, il parler, parce que c'est lui qui a mené, et c'est lui qui loi. Et ça n'a jamais fait ici en bas, nous, Mr. Speaker. Et pièce moun qui va conduire, ou qui a conduit, et c'est où qui a dit qui les gens qui a parlé. So, là, maintenant, même Parlement pour choisir, qui a venu dire ces bagages là. Je moi que c'est vrai, il y a vrai, esprit, il y a fait ça comme Parlement Babono Kali. Mr. Speaker, I sat back on Tuesday and I couldn't help but conclude that after 3 short years at the helm of this country, this Prime Minister has distinguished himself as one of the best Prime Ministers to preside over the affairs of this country. And in the words of Jeremiah, not the prophet, but the MP for Mikunov, Mr. Speaker, it was another masterclass. The Prime Minister presented one of the best budgets of modern times in any Caribbean country, Mr. Speaker. Mr. Speaker, the budget was bold. It was comprehensive. It was deliberate. It spoke to a visionary leader, and it reflected a man whose philosophy is rooted in compassion and love for the people of St. Lucia. Mr. Speaker, to use a colloquial expression, the budget had something for everybody, irrespective of your station in life. It was a budget for the business community. The teachers saw their benefits in the budget. The farmers are excited about the pronouncements that were made in this budget for them and their fortunes, Mr. Speaker. The police, Mr. Speaker, are happy with the budget. The students of this country, from kindergarten to university level, are happy with the pronouncements that came out of the budget presentation. And so, Mr. Speaker, that is a man, after 4 consecutive years at the helm, has registered economic growth, Mr. Speaker. The lowest unemployment figures on record. And so today, Mr. Speaker, I am duty-bound to stand and provide and give my unequivocal support to the budget as presented by the Prime Minister. Mr. Speaker, I have a very huge ministerial portfolio. 2 major departments, the Department of Education and the Department of Sustainable Development. And I know time is limited tonight, and so, Mr. Speaker, I will proceed to make some pronouncements on the work program of the Department of Sustainable Development in the Ministry of Education, Sustainable Development, Innovation, Science, Technology, and Vocational Training. Mr. Speaker, as St. Lucia and the rest of the world grapple with the triple planetary crisis, and triple planetary crisis is a term that encapsulates that connectivity between climate change and biodiversity loss, and climate change and pollution, and how they come together to affect the health and the well-being of our planet. Mr. Speaker, our response to the triple planetary crisis resides in the various programs of the Department of Sustainable Development. And so I am immensely pleased, Mr. Speaker, to share with this Honorable House the tremendous work that is being done by the Department of Sustainable Development. They have a very small staff complement, Mr. Speaker, when compared to other government departments, but the results have always been tremendous over the various thematic areas, namely climate change, biodiversity, chemical and hazardous waste, ocean governance, and coastal zone management, to name a few. And one of the key programming areas, Mr. Speaker, is climate change. St. Lucia and other SEEDs or small island developing states face significant and disproportionate threats from climate change. Threats that include rising sea levels, more frequent and intense storms, coastal erosion, food and water insecurity. Mr. Speaker, as a result of climate change, we are witnessing sea level rise. The polar caps are melting, and this is causing our oceans and our seas to rise, thereby causing erosion on the coast of small island states. It is so severe in some parts of the world, Mr. Speaker, that some islands it is predicted that they will disappear in the next 30 to 40 years. And the effects of climate change can be quite debilitating on small island states like St. Lucia. It compromises safety, Mr. Speaker. It affects livelihoods and infrastructure, and it poses an existential threat to us, Mr. Speaker, as small island developing states. Mr. Speaker, a Category 4, Category 5 hurricane only needs 30 minutes to decimate the economy of St. Lucia or another small island state. And when your economy is devastated, your GDP is rendered zero, Mr. Speaker, you are brought to your knees, and then you have to rely on a very unforgiving and uncaring international community to mobilize resources to get you to start again. And so at COP in Sharm el-Sheikh a few years ago, Mr. Speaker, St. Lucia and the rest of the Caribbean, we were extremely happy when we learned and we participated in discussions for the formation of the Loss and Damage Fund. It is a facility that we expected to tap into, Mr. Speaker, to help deal with some of our climate adaptation and climate mitigation situations. And what do I mean by climate adaptation and climate mitigation? Mr. Speaker, climate adaptation speaks to the interventions, the programs, and the things that we have to do as a country, Mr. Speaker, to adapt to the things that have been brought on us as a result of climate change. Whereas mitigation, on the other hand, speaks to the things that we have to do to help minimize the impact of climate change, not only on St. Lucia, but on the globe. Mr. Speaker, last year, I introduced the Green Climate Fund National Adaptation Plan Readiness Project, under which St. Lucia would receive $4.5 million to implement a GCF readiness and participatory support grant to develop adaptation strategies and action plans for the remaining priority sectors of education, tourism, and infrastructure and spatial planning. Mr. Speaker, I can report that over the last year, much progress has been made with the development of the education adaptation strategy and action plan, with the draft plan developed and circulated among stakeholders of education, teachers, parents, principals, the teachers' union, and all other stakeholders, with a view to ensuring that the plan reflects the expectations of the people whom it is intended to impact most. Mr. Speaker, efforts have already been initiated on the other two strategies and action plans for tourism and infrastructure and spatial planning. Mr. Speaker, climate change is everybody's business. Everybody's business. The government has a vested interest in climate change. The private sector ought to be concerned with what is happening with climate change, because at the end of the day, Mr. Speaker, climate change affects everybody. Mr. Speaker, the Department of Sustainable Development is programming heavily in relation to biodiversity restoration. And through the Southeast Coast Project, which is mainly funded by the UNEP, the United Nations Environment Program, and GEF, and a considerable amount of work has been carried out in the Southeast Coast projects, Mr. Speaker, on the Southeast Coast projects, in communities such as Vieux-Fort, Labrie, Monrepo, Micoud, with a view, Mr. Speaker, to sensitizing the locals to the benefits that can be derived as far as livelihoods are concerned as they use the natural resources at their disposal. Mr. Speaker, another area of programming under the Department of Sustainable Development, this time through a statutory entity, the St. Lucia Solid Waste Management Authority. The St. Lucia Solid Waste Management Authority exists to enhance St. Lucia's environmental integrity and the health of citizens through the provision and management of an integrated system of public education and awareness for collection, treatment, recycling, and disposal of solid and hazardous waste. Département or agency gouvernement qui nous responsabilité pour amasser zordi et puis make sure nous mettons zordi nous dans place ko is safe, Mr. Speaker, ko il va mener disease et affecter santé moun. C'est agency qui a conduite moi comme ministre Sustainable Development and ministre Education. The goal is to improve existing standards of public health and environmental quality through more efficient waste management. Mr. Speaker, there is more to waste collection and waste management than a truck driving through a community twice a week or 3 times a week to collect household waste and to dump it at the landfill. There are different categories of waste that we have to contend with on a daily basis. Mr. Speaker, you have household waste. You also have waste being generated at your hospitals. When surgeries are performed and limbs are amputated, we must have a place to dispose those, and there must be a particular method to ensure, Mr. Speaker, that we are not encouraging the spread of diseases and things of that sort. Mr. Speaker, you will recall in 2018, the government of St. Lucia, with funding from the Caribbean Development Bank, engaged a firm from Malaysia, Pemandu Associates. Pemandu was able to convince the then administration in 2018 to incinerate solid waste with machines from Malaysia. In other words, Mr. Speaker, the company from Malaysia came here, they engaged the government in a discussion, and they were able to say to the government, instead of having a landfill where you can dispose of your garbage, we have a machine that we can sell to you where you can burn all your garbage and you will be landfill free by a particular date in this country. Mr. Speaker, the Carino waste decomposition machines were purchased. And so the government entered an agreement with the company on the 2nd of August 2019 to purchase 20 incinerators at a cost of $10 million to the government of St. Lucia. Mr. Speaker, in 2019, they entered the agreement. To date, $10 million gone down the drain because the technical report that was received from the staff at Solid Waste, Mr. Speaker, indicate that that was a waste of money and there were no benefits derived from such an initiative by the people of St. Lucia. And you know what, how we pay for it, Mr. Speaker? Every single month, we are transporting between 65 to 70 containers of waste monthly, Mr. Speaker, to Deglo landfill from Vieux-Fort. And every morning, Mr. Speaker, you have to see the long lines of traffic behind those containers. The stench is too much for people in the communities where those container trucks traverse, Mr. Speaker. Loss of productive hours by people commuting to work. Children are reaching or arriving at school late because of that particular arrangement, Mr. Speaker. And every month, this government has to continue finding $75,000 monthly just to ensure that we transport the waste from Vieux-Fort to Deglo. That was a problem created by. But a member for Choiseul, in all of his recollections, he recalls that TVET was an initiative of their government. He claims the first generation program. He remembers all the projects that were stopped, but he does not remember that it was his government that spent $10 million buying incinerators that never worked, that never benefited the people of St. Lucia, and that every month we must find $75,000 to haul garbage. Mr. Speaker, do you know what I can do in the early childhood sector with $75,000 a month, Mr. Speaker? Do you know what $75,000 a month can do for the people of Grand Ravine and Gardet and Denier Riviere and Olio and Lapel, Mr. Speaker? But he does not claim those. But Mr. Speaker, we are doing our best to cure that particular problem. And so, Mr. Speaker, the Solid Waste Management Authority has been working diligently with the World Bank through the UBEC project to do a number of things, including a feasibility study to determine the exact location for a waste disposal site in the south. Mr. Speaker, we are also working with the World Bank to revise the current Solid Waste Management Authority Act. The legislation has been around for some time. It needs some refining to make the agency a little more purposeful and more potent than it is for the time being. Mr. Speaker, also at the level of the Solid Waste Management Authority, the government has agreed to increase the fees being paid to waste haulers in this country, Mr. Speaker. In this new financial year, the government will increase the contract fees paid to waste collection contractors. This is the first such adjustment since 2015, Mr. Speaker. Since 2015. And I can tell you, because I know firsthand some of the challenges that waste haulers encounter as they look to provide this very necessary service in the various communities. Mr. Speaker, we have built concrete roads in many of the communities, and we have a problem in a lot of the pocket communities where people choose to park their vehicles on the concrete roads, and that is creating a major problem for the various refuse collection trucks, Mr. Speaker, as they try to service communities. And in some areas, the contractor has to get a pickup vehicle to enter and penetrate certain parts of communities and to haul the waste down to the main road and then to transfer it onto the truck that would take it to the site. And this has increased the operations cost significantly. And I believe, and it is the wisdom of our government, to provide an increase to the waste haulers. I'm sure Mr. Innocent Sado, with whom I've had several meetings, and who usually, Mr. Speaker, makes representation on behalf of his fellow waste haulers, will welcome news that in the very near future, we will honor our commitment and our promise, as the Prime Minister would have indicated, promises made are promises that are meant to be kept, and that they will receive their increase. Mr. Speaker, still on the sustainable development, I want to draw your attention to the Pito management area. Mr. Speaker, the Pito management area was inscribed on the UNESCO World Heritage List on June 30th, 2004. And Mr. Speaker, the benefits of World Heritage status include enhanced protection and conservation, increased tourism arrivals, greater international recognition, it attracts funding, and so many other benefits. Mr. Speaker, we have a situation with the PMA where, Mr. Speaker, a lot of the lands within the demarcation of the PMA are privately owned and some owned by the government, the King's Chain, etc. And so private landowners within the demarcation of the PMA, and there's not much I can say about it, Mr. Speaker, because the matter is before the courts, or it is said to be sub judice. Mr. Speaker, private landowners want to embark on certain projects within the PMA that can place our World Heritage status in jeopardy. And so the government of St. Lucia some years ago embarked on what is known as a LAC study, limits of acceptable change, in terms of how you can change the natural environment within the PMA demarcation. And Mr. Speaker, proposed developments, as I indicated, by private landowners, have triggered very robust discussions, some of which have ended in the courts. Mr. Speaker, I want to place on the parliamentary record that our government is committed to working with the landowners to ensure that we preserve the World Heritage status that we currently enjoy with UNESCO. And so I must thank, Mr. Speaker, the parliamentary representative for Soufriere Saint-Jacques for working with the PMA and working with the staff of the Department of Sustainable Development in our quest to ensure that our status is not jeopardized. I want to thank Joan Hippolyte, the manager of the PMA, and her staff, Glenda, Joanna, Chroma, and Celia, for the tremendous work that they are doing in Soufriere in policing the PMA and ensuring that it remains in as pristine a condition as it is today. Mr. Speaker, I want to turn your attention to the Department of Education. The Prime Minister, in his budget address on Tuesday, Mr. Speaker, spoke about early childhood education. Mr. Speaker, early childhood education remains a top priority for this government. 9 state-of-the-art pre-K classrooms have been commissioned, along with a new early childhood development center in Patience, Micoudnof. Another center is set to be commissioned in Bel Air in the coming year, collectively providing educational opportunities for 250 vulnerable children. Mr. Speaker, in August 2024, the government provided a one-time grant of $2,500 to 105 preschools to support the procurement of educational supplies. Mr. Speaker, the bulk of the early childhood effort in this country is being made, and the bulk of the load is being carried by private early childhood and preschools. And so, Mr. Speaker, it is only a conscionable government. It is only a compassionate Prime Minister, in recognition of this fact, who will find monies in the public purse and say to the private early childhood practitioners that we understand what you are doing. We understand the significance of your service to nation building. We understand the importance of what you're doing to providing the foundation for the children who will become the citizens of tomorrow. That we can meet you halfway and say, here is a contribution that you can use to improve the services to the children of this country. Mr. Speaker, in addition to the grant of $2,500 to the 105 preschools, in January of 2025, a further $170,000 in subsidies was allocated to benefit 3,409 parents, offering a $50 subsidy towards school fees for children in early childhood. This subsidy will be doubled in the new school year, beginning in September of 2025, as part of the government's broader vision to strengthen early childhood education and achieve universal early childhood education in alignment with the United Nations 2030 agenda. Mr. Speaker, we ushered in the St. Lucia Labour Party universal primary school education. It was the St. Lucia Labour Party that ushered in universal secondary education. And today, Mr. Speaker, we are making the bold and progressive pronouncement that we will be the administration, or we are the administration that will usher in universal early childhood education. And that no child will be left behind, Mr. Speaker. Whether your parents can afford the fees or not, once the child has reached a level of maturation where he or she can be at preschool, this government will facilitate that particular initiative to ensure, Mr. Speaker, that every child is comfortably accommodated at an early childhood education center in this country. Mr. Speaker, a Taiwanese grant of EC $1 million will facilitate introduction of pre-kindergarten programs at 4 primary schools. This initiative will create additional learning spaces, increasing capacity, and accommodate approximately 60 children. Training programs, Mr. Speaker, on the infusion of ICT in SEND pedagogy for early childhood educators is something that we are already embarking on. We will provide training for early childhood educators, and early detection of learning impediments in children is something that we will pay close attention to as we train our early childhood educators. We will procure, Mr. Speaker, as we have in the past, assistive technologies for SEND, or special needs education students, Mr. Speaker, and ICT equipment for 4 strategically located early childhood centers in this country. Mr. Speaker, as I visit the various early childhood centers in this school, I can report to this honorable house that there is need for standardization, there is need for standards. Let me aller at the different communes, Mr. Speaker. Et quand on regarde toute l'école, et ça nous qui est preschool, Mr. Speaker. Oui, mais qu'on l'année moun qui a pour bailler un service, comment maman ça quitter issue because on y a un journée travail pour y faire. Ko papa ça mette issue because on y a un journée travail pour y faire. Et comme Mr. Speaker nous comprendre significance qualité service là. Nous ka dit il pas assez pour juste mettre ces maman là en dans ces places là koyoye. But nous ni pour ni en plan côté nous hen toutes ces écoles là pour where you can operate at a standard that is acceptable and in conformity with what should be passing for early childhood education in this country. We have to address issues of standards in relation to the physical environment. The space must be child-friendly. It must be stimulating. It must be appealing to the senses of the children. It must be clean. It must be sanitized, Mr. Speaker. It must have adequate lighting. And the environment should not be intimidating to the children who have to reside there on a daily basis. Mr. Speaker, CXC fees, facilities fees. The Prime Minister was very clear and very concise when he spoke about our government's commitment to paying facilities fees and CXC fees for the children of this country. Government remains committed to strengthening social safety nets by providing support to parents. And support can manifest itself in so many different ways. And when we say we are paying facilities fees, or we are continuing to pay facilities fees and CXC fees, Mr. Speaker, we are making an intervention. We are bolstering and strengthening the safety nets for parents in this country. And Mr. Speaker, I remember being a teacher for many, many years, and facilities fees and CXC fees have always been vexing issues for parents. But this government, $2.2 million annually in facilities fees for more than 26,000 primary and secondary school students. Additionally, Mr. Speaker, $400,000, Mr. Speaker, for CXC subjects, one science subject, and one foreign language. And Mr. Speaker, why one foreign language? Why one science subject? We are preparing our children, as I would have said here before, not to confine their imaginations and their dreams to the shores of St. Lucia. But our education system is meant to create global citizens. So that a child, Mr. Speaker, whether at the primary level or secondary level, if he or she has to exit our school system, that child should be at a state of readiness where he can immerse seamlessly into a classroom with his or her counterparts, whether they're in Singapore or they're in the United States of America or they're in Canada. And that is why, Mr. Speaker, we are making it compulsory for foreign languages to be taught at both the primary and the secondary level, Mr. Speaker. So, Mr. Speaker, every child who will be registering for CXC CSEC, not CXC CAPE, but CXC CSEC, the secondary program, will complement the government of St. Lucia, have mathematics, English language or English A, one science subject, and one foreign language paid by the government of St. Lucia. Mr. Speaker, a university education is crucial for personal and community advancement. Having a university education, it fosters individual growth. It enhances career prospects. It drives innovation. It broadens an individual's understanding, a community's understanding, and a country's understanding of the world within which we live. Having a university education in St. Lucia, Mr. Speaker, makes St. Lucia more competitive than we would have been. And that was the thinking behind the Honorable Prime Minister's program of having at least one university graduate per household. And Mr. Speaker, for the past 4 years, this government has invested roughly $10 million in tertiary education in this country. And Mr. Speaker, I can report to this Honorable House that when you consider the bursaries offered at Soufriere Hospital Community College, you look at the UniPass, the University Package of Assistance for Student Success, you look at mainstream scholarships, Economic Cost Award for UE landed and global campuses, you look at the CDP contributions to supporting higher educational pursuits at the community level, I can pronounce boldly in this parliament that our government has assisted and provided approximately 2,000 opportunities of higher education for the citizens of this country in 4 years. Mr. Speaker, this new financial year, the drive will continue. 50 full scholarships with Monroe College for the first generation program. An additional 17 scholarships, 3 of which will be full scholarships and 14 partial scholarships also with Monroe College. We are estimated to have this year, Mr. Speaker, 29 scholarships with the Republic of China, Taiwan, Mr. Speaker. 30 scholarships with the Cuban government. Over 10 scholarships with the Hungarian and Moroccan governments. 120 bursaries with the Soufriere Community College. And Mr. Speaker, stipend to nursing students pursuing their studies at the Soufriere Community College. Mr. Speaker, Economic Cost Awards go to students studying at the University of the West Indies. And as I indicated, students at the London campuses, namely Mona, Keville, St. Augustine, and Five Isles in Antigua. Mr. Speaker, other scholarship opportunities will come through the OAS, the Commonwealth, Chevening, etc. So, Mr. Speaker, we are catering for the students of this country. We are not only laying the foundation at the early childhood and primary levels, but, Mr. Speaker, we understand the value. We understand the returns that can come when we invest in higher education, when we train our people so they can be on the same plane with their counterparts, irrespective of where in the world they're from. A St. Lucian trained economist, Mr. Speaker, is just as good as an economist at the World Bank in Washington. A St. Lucian doctor, Mr. Speaker, notwithstanding all what you've heard about our doctors and people trying to derail the efforts of our doctors, are just as good as their counterparts from almost anywhere in the world, Mr. Speaker. And Mr. Speaker, as I indicated, and the Prime Minister himself made the pronouncement, we are providing stipends, Mr. Speaker, stipends to students pursuing nursing programs at the Soufriere Hospital Community College. Mr. Speaker, nurses play a critical role in healthcare delivery everywhere in the world. Nationally, we've been able, Mr. Speaker, or we've been operating with a deficit, and I'm sure the Minister of Health would have alluded to that in his presentation. We are operating a deficit of approximately 120 to 150 nurses on average. Mr. Speaker, système santé Saint-Lucie, tous les années, système santé nous, il short, eh bien, il a marché à peu près 120 pour 150 nurses en l'hôpital, en health center, et puis un système généralement. Except pour raison ça là. Un petit pays qu'on nous a marché plus que 100 nurses en système là. On est pour tirer chapeau. Et on est pour dire merci pour ces nurses là qui ont été caillou devant jour. C'est ça qui a été caillou 5h, 6h après-midi, et ça c'est demain bon matin qui a venir. Et you can aller là et travailler. To give an honest day's work. To sacrifice, Mr. Speaker. Making a contribution to the development of the country. Mr. Speaker, all they need from us is compassion, love, expressions of gratitude, but not try to derail them because you get carried away on a platform ahead of an election that you will lose anyway, Mr. Speaker. Why do that to the nurses and healthcare professionals? And so, Mr. Speaker, with the Soufriere Hospital Community College being the primary training facility or institution for nurses in this country, where we graduating on average 35 to 40 nurses annually, Mr. Speaker, I am happy.
Remember, you have 15 minutes left.
I am elated, thank you, Mr. Speaker, when I heard the Prime Minister himself in his budget presentation speak to the nation and tell the nurses and by extension all St. Lucians how nurses are going to benefit from the goodwill of this government. And let me say, Mr. Speaker, that even before COVID, the World Health Organization had already estimated that there was a 6 million shortage of nurses worldwide before COVID. And you know what happens, Mr. Speaker? Since COVID, the situation has been exacerbated across the globe. And what happens as a result? Countries with resources, countries with money, they are able to lure and entice our nurses to come and work for them, Mr. Speaker, at much more lucrative amounts than we can pay as a salary. And that is why, when a nurse can turn down an offer to work in Canada or in Bermuda or the US and she decides that she's going to toil in this country, because like us and like all patriots, she has a vision where she wants to see a St. Lucia, Mr. Speaker, where we can be globally competitive, Mr. Speaker, we have to support the nurses. And so for the ensuing academic year, the new academic year, nurses entering the program at Soufriere Community College, first-year students or entry-level students, will receive a tuition grant of $2,500. Second-year nursing students, Mr. Speaker, will also receive a tuition grant, complements the government of St. Lucia, of $2,500. The third-year students, Mr. Speaker, who would have gone through the rigors of year one, they would have toiled in year two. And Mr. Speaker, the workload is beginning to catch up with them. And they have to think of tuition fees. Our government is saying to them, we are saying to them as a government, that when you get to year three, we are paying half the tuition fees for you, and we're giving you a grant of $5,000. And Mr. Speaker, some of them would have struggled in year one. They would have struggled in year 2. They would have struggled in year 3. And for those of us who have been exposed to higher education, I am sure you can relate that the nearer the finish line gets, the more challenging the programs become. And sometimes you even begin to doubt yourself. And we're saying to the final year students, the 4th year students, that we are meeting your tuition at the Soufriere Hospital Community College in full. In other words, we are paying the $10,000 tuition fee for you when you get to the 4th year. So that you don't have to worry about paying monies in the 4th year. But instead, we are already conditioning your mind whereby you can begin to take your rightful place at a health center or a hospital to discharge and dispense services to the people of this country. This is what a compassionate government does. Mr. Speaker, l'année, ça nous a créé un shortage. Nous pas tenir assez nos en système santé nous. On l'a té à attendre côté l'année presque 6 millions nos qui a marché. Ouais, il pas marché, mais système là besoin 6 millions nos pli passer nous ni. Exactly si quanti pays nous besoin nos tout. Et premier ministre la dit nous that since Soufriere Community College c'est place là que nous ca étourner monde pour faire nos. Nous avons en l'année 9 éducation qui a commencé, ça en anglais nous avons créé académique hier. Nous avons commencé par c'est maman là qui a fait études de nos plus support parce qu'il a joué pour le moment. So that maman qui a venu pour premier monde qui a venu faire nos en première année. Il y a un hot gouvernement ça là. $2,500 pour payer pour l'école yo. Monde qui en deuxième année programme c'est pour 4 années, c'est monde qui en deuxième année qui a $2,500. Moun qui a 3e année qui a $5,000 ça c'est half là yo aussi supposé payer pour études yo. Et c'est moun qui a 4e et dernière année qui a un hot gouvernement nous $10,000 pour payer pour l'école yo pour que yo fini programme là et puis yo fini et puis en l'idée puis un chill qui a un école yo pour payer pour aller travailler en l'hôpital là et en ce health center. Mr. Speaker, what about the teachers of our country? I'm a proud teacher. And I always say to people when they ask me and I travel, professionally, what are you? And I'm always quick to remark, Mr. Speaker, that I'm a teacher spending time in the corridors of politics. I'm a trained teacher. I taught, Mr. Speaker, for more than a decade. Mr. Speaker, I spent 2 full-time years at the Soufriere Community College Division of Teacher Education and Educational Administration. And I know, Mr. Speaker, the Prime Minister was a teacher, Mr. Speaker. I've just been reminded. And so, Mr. Speaker, I understand the plight of teachers. So, Mr. Speaker, when the teachers of this country were receiving a teaching materials allowance of $800, Mr. Speaker, this Prime Minister in 2023 said that we need to stop and take stock. And he increased it, Mr. Speaker, by $600, so that today every teacher in the system receives what we call the TMA, or the teaching material allowance, prior to the opening or the commencement of the new academic year. They get reflected on their salary slips $1,400. And the TMA is not for teachers to buy clothes. The TMA is not for teachers to spend on fancy things. And I can tell you that there are teachers, the majority of teachers in this country, would spend a lot more than the TMA to ensure the readiness of their classrooms, the readiness of their children, to make the learning environment more inviting than it is prior to the opening of school. And I've said it in here before, when they travel, whether it's to the UK, Canada, or the US, sometimes they pull in with them when they get off the aircraft or out of the baggage area 2 suitcases, Mr. Speaker. And I can assure you, for the majority of them, 1 suitcase is all about instructional aids, materials to motivate students and to make the learning experience more exciting. And in recognition of that, we increase the TMA so that every teacher today can take home $1,400. Mr. Speaker, on page 67 of the budget address, and I quote, temporary teachers will now receive full salaries for the month of August. Now, Mr. Speaker, you can criticize that as you want. And I say you, not you, Mr. Speaker, figuratively speaking. People who criticize this, they do not understand the plight of temporary teachers. When you do not get your salary for the month of August, Mr. Speaker, it triggers a very serious pattern of disruptions for you, Mr. Speaker. Loans, small loans have to be serviced. Family commitments have to be met. Basic living expenses, Mr. Speaker, are compromised, especially for teachers who have a lot, and some of them they're temporary. And in addition to having to look after themselves and their children and their family, Mr. Speaker, they have to lend support to people in the extended family and even neighbors. So when I heard the pronouncement made by the Prime Minister, I was just as elated as any temporary teacher would be benefiting from this particular initiative. Mr. Speaker, ICT laptops and content development. There is an indispensable role for ICT in education. You cannot be speaking about education in 2025 and beyond if you do not have an appreciation for the role that ICT or technology can play, Mr. Speaker, in the education process. Mr. Speaker, we will continue to provide laptops to the children of this country. And when the United Workers' Party administration stopped the laptop program, Mr. Speaker, when they stopped the laptop program that was instituted by Dr. Kenny Anthony, the member for Beaufort South, and then Education Minister Robert Lewis, Mr. Speaker, they were making a mistake. They were making a mistake, Mr. Speaker. But today, I am happy to report in this honorable House that every single secondary child in this country has a laptop computer, complements the government of Salvation. Mr. Speaker, there's more to technology in education than laptop computers. We will continue to transform traditional classrooms into smart classrooms, Mr. Speaker. And Mr. Speaker, we will continue to provide the laptops as well. And our government has provided over 7,000 laptops ever since we came into office. Mr. Speaker, we have provided a more affordable $11.49 EC per child compared to the US $100 license fee per child paid by the United Workers' Party administration. As a result, Mr. Speaker, of this, we are saving $260 per child, or $260
Remember, you
multiplied
have
by
5 minutes left.
I'm not taking half.
Yeah, Mr. Speaker, I move that Standing Order 32.8 be suspended to allow the honourable member another half hour to finish his presentation.
Honourable members, the question is that Standing Order 32.8 be suspended and 32.10 invoked to allow the member for Denry North an additional 30 minutes. I now put the question: as many as have their opinion say aye. As many as have a contrary opinion say no. And the ayes have it. The ayes have it. Please proceed.
Thank you, Mr. Speaker. Thank you, colleagues. Mr. Speaker, I was making the point that the government has registered significant savings since we restored the laptop program compared to what obtained under the United Workers' Party administration. We've been able to save $2.8 million. Because, Mr. Speaker, during the reign of the United Workers' Party, they entered an agreement with a company, Mr. Speaker. We knew of the existence of that partnership before we came into office. But we were very responsible. That even if we had misgivings about agreements that the government entered into with private companies, we were not reckless to go out on the market steps or elsewhere and threaten private investors or companies that had agreements with the government. The responsible thing for us to have done is precisely what we did. When we came in, we reviewed the program, Mr. Speaker, and we stopped it. Mr. Speaker, the monies that we've been able to save, the 2.8 million that I mentioned earlier, has been used to bolster our TVET program. It has also been used, Mr. Speaker, to lend support to the First Generation Scholarship Program and other initiatives in education. Mr. Speaker, digital content development for secondary schools. The Department of Education has, over the past 2.5 years, been developing digital content in 10 subject areas of the lower secondary school curriculum. This complements, Mr. Speaker, the laptop program, and full implementation will take place in September 2025 following the final review of 4 subjects currently being undertaken. Mr. Speaker, let me tell you what obtained before. The United Workers' Party administration entered into an agreement with a foreign company. The company provided devices that were substandard. They were flimsy. Mr. Speaker, the rate at which the devices were being damaged was just not acceptable for the amount of money that was being spent on those devices. And despite, Mr. Speaker, the technical staff in the Ministry of Education admonishing the government of the day and saying that there can be a better alternative, they, Mr. Speaker, proceeded with the devices. We came in and we had to replace. The company developed the content. We are paying the license fee per child. We have the device that is flimsy, but the content remains the property of the company. So that if the government decided at the time that they were pulling out of the agreement, they would have no access to the content for which they were paying license fees. What have we done, Mr. Speaker, as an alternative? We have taken the teachers from our school system, working with our curriculum officers, and they have developed culturally relevant content for our secondary school students to use on our laptops. But Mr. Speaker, I saw on Facebook very recently where the leader of the opposition and the United Workers' Party, they have boldly pronounced that if they get into government, they will return to the same e-books arrangement for the students of our country. Can you imagine, Mr. Speaker, where I told you we are saving $2.8 million. The license fees that were being paid to a foreign company, it stays here. We use that money to complement what has been allocated for first-generation scholarship. We use that same amount for TVET programming, Mr. Speaker. And they have the gall. They're bold enough to tell St. Lucians that if they win the election, which they will never do, they will return to this. And so, Mr. Speaker, I must commend the staff at the CAMDU for leading this initiative. Mr. Speaker, plant and equipment. Mr. Speaker, we have spent a lot of money in the last financial year, and we've allocated a lot more for the rehabilitation of school plants in this country. Through the Afri-Exim Bank, we was able to secure $6 million, Mr. Speaker, to rehabilitate approximately 25 schools in this country. But the scope of works varied based on the needs of the school. And just as I did in the debate on the estimates, I did apprise this Honorable House of the work that is ongoing at the Plainview Combined School in Viewfort South, the Pero Combined School in Viewfort North, the TVET School of Sustainable Agriculture and Culinary Arts, and the Enchibo Secondary School, where new blocks are being constructed. Mr. Speaker, while the government acknowledges that an overall budget of $48 million is required for major upgrades and rehabilitation, this year we have committed $12.6 million to this initiative. The 2025-2026 budget will prioritize critical improvements in health and safety, including upgrades to perimeter lighting, fencing, electrical systems, and major roof repairs and plumbing and sewer infrastructure. These investments underscore the government's dedication to creating a secure, modern, and well-equipped learning environment that will support academic excellence and students' well-being. So, Mr. Speaker, we put a premium on education. We are covering all our bases in education. And Mr. Speaker, recently, we were able to secure for the Caribbean Development Bank approval for the PERT, P-E-R-T, the Program for Education Realignment and Transformation. Approximately every 5 years, Mr. Speaker, the government of St. Lucia with the Caribbean Development Bank would enter into an agreement where a major intervention is made to improve the quality of education and education infrastructure. And so in times past, you would have heard of the BIP. We have just wrapped up we are in the process of wrapping up the EQUIP. And so the PERT will be commencing where an amount of $30 million, Mr. Speaker, 17 million loan, 4 million grant, and the government of St. Lucia is expected to provide 9 million counterpart contribution for the execution of the PERT. The PERT was approved at a CDB board meeting in December of 2024. Arrangements are currently being made to facilitate project signing and commencement. Major infrastructural projects will happen at quite a few schools in this country, Mr. Speaker. The list is exhaustive, but I'm sure it will delight the member for Soufriere to learn that a block will be constructed at the Soufriere Comprehensive. Mr. Speaker, in the interest of time, I will not mention the other schools, Mr. Speaker, and the constituencies that will benefit in the interest of time. Mr. Speaker, foundational skills and support systems at the primary level. The OECS pool. An early learners reading and math assessment was developed in 2024. A pilot of the assessment tool was implemented in October 2024. Full implementation will be in May 2025 and will provide real-time data that will facilitate remedial action and allow St. Lucia for the very first time to meet international reporting obligations. Mr. Speaker, school security, I would have hinted earlier, as I did in the debate on the estimates, that school security has been a vexing issue for educators, in particular the St. Lucia Teachers Union, and rightfully so. Mr. Speaker, the union will not flinch, they will not cower, and they will not compromise as it relates to the security and safety of their members in much the same way, Mr. Speaker, they advocate for the security and safety of the children. And so as the Minister for Education and my cabinet colleagues with whom I've discussed this, we are all on the same page. And so this year, Mr. Speaker, you will see increased fencing work at select schools, improved perimeter lighting, we'll be installing CCTV cameras or continue to install those cameras, we'll be installing alarm systems, increased personnel to complement school security, Mr. Speaker, and we'll have private security firms in select areas. I must admit that there are some schools in St. Lucia that are not fenced, and we do not have much of a security threat for the time being. But we have some hotspots, for want of a better word, where certain communities are proven to be more volatile than others, and so the interventions have to reflect the peculiar circumstances of those communities. Mr. Speaker, the South Louis Community College is also in the purview of the Minister for Education. And just to go through some college highlights, Ms. Faith Regis placed third in the region in the Cape Literatures in English program, Mr. Speaker. That is a monumental achievement that must be celebrated. Mr. Speaker, Ms. Nehal Wadrani, a Cape student, was one of 3 awardees international to win the Women in STEM Award at the first Global Robotics Challenge earlier this year. At this event, she also hosted a panel discussion on intersectionality in STEM, addressing challenges and embracing diversity. Mr. Speaker, it has been, and maybe that is what the member for Choiseul should have claimed when he spoke, the discussion on transitioning the South Louis Community College into a university. Mr. Speaker, university status remains a vision of the leadership of the South Louis Community College. And given that the college already offers 6 degree programs, the board has received technical advice recommending that the college be recast as a university college. The college is currently has started discussions, Mr. Speaker, with a number of stakeholders, local and elsewhere, with a view to realizing that particular goal at the soonest. Mr. Speaker, the board has done several things, including they've strengthened governance for the adoption of the board charter and charters for the chairpersons and for various committee members of the board. They've also revamped the functions and operations of the academic board to streamline the academic offerings of the college. Membership of the board will include not only internal academic staff, but also industry partners in its composition. The academic board, with input from the St. Lucia Teachers Union, is reviewing the workload of lecturers to ensure continuous improvement in quality of instructions provided by lecturers. Additionally, an industry curriculum committee has been established to review courses programs for their relevance to the needs of the market. And so, whether it's at the level of the South Louis Community College or at the primary or secondary level, content and curriculum must be relevant to industry. That is the essence of school. That is the essence of higher education, where you prepare people for the world of work and to fill the skills gaps that exist in your workforce. Mr. Speaker, there's a lot more I can say about the South Louis Community College, where they've completed the draft administrative process that has been written for each department. The college has also developed an HR policy and strategy. They've completed a compensation study to enable the college to recruit and retain competent managerial staff through competitive salaries and other benefits. Mr. Speaker, for the South Louis Community College to remain relevant and competitive regionally, we have to begin to attract the best minds to provide quality leadership that will make us competent. We cannot be relevant only with paint on the building, but the personnel who drive the college, the lecturers who instruct the students must be of a particular world-class standard as exists now at the college, Mr. Speaker, for us to continue remaining competitive. The college has completed a draft student charter that firmly establishes the expectations of students. The college has approved a framework for creating the ideal lecturer for the college. No longer, Mr. Speaker, will it be that you can get a job as a lecturer at Sir Arthur because of your academic achievements. You need a lot more than that. You need to understand the impact of tertiary education to national development. You need to understand that the young people interested in your care, Mr. Speaker, are being molded so that they can take their rightful places in the world of work. And there's so many other achievements and initiatives at the South Louis Community College, Mr. Speaker, that I would love to get into, but in the interest of time, I can't. Mr. Speaker, we've brought back the principal assistants because of the demands, the increasing administrative demands in schools, primary schools. Our government has provided and made available additional monies to recruit more principal assistants. When we introduced the program that was stopped by the UWP, Gouvernement Flambeau du bout, Mr. Speaker, programme là côté mettre tous et puis mettre l'école en système premier nous, t'es qu'ani en secretary pour aider yo faire bagaille. Gouvernement Flambeau vini avec yo du bout ça. Nous mener vie et nous gagne élection. Et nous pas seulement mener vie, mais en budget ça, Premier ministre là, j'ai metté l'argent là, que nous gagne mener plus pour hand principals assistants at some of the schools that were not serviced when the program was first reintroduced. Mr. Speaker, the Creole in Schools program continues, and Mr. Speaker, I've asked my staff to make allowances for any member of parliament who want to learn the Creole language at the elementary level. I, as Minister of Education, would waive for you and ensure that you get quality instruction so that you can understand. Mr. Speaker, I don't have the authority to waive fees, but I'm sure the Minister of Finance will ask me to take a memo to Cabinet and get a conclusion to ensure that such happens. Mr. Speaker, enhancing special education. In the 2024-2025 financial year, the subsector benefited from $200,000 in the provision of assistive devices, specialized diagnostic tools, and specialized laptops to enhance the instructional programs with teachers and students in special needs. So special needs students have special devices. We call them assistive devices that would help them learn. And Mr. Speaker, when I listen to the member for Miku North, in his capacity as the minister with responsibility for persons with disabilities or differently abled persons, Mr. Speaker, it warms my heart to know that our government, the compassionate government that we are, and I alluded to that at the embryonic stages of my presentation, that there was something in the budget for everybody in this country, irrespective of your station in life. And so we take special needs education very, very seriously. I remember, Mr. Speaker, having some very robust discussions at the Ministry of Education, where I wanted to see special education needs facilities in different communities. But the practitioners are saying to us, the technical people in the Ministry of Education, that this is not the way to go. They want for the differently abled students to be integrated in mainstream education. And I see the merit in this, Mr. Speaker. But you must have the trained personnel, and in some instances, you have to complement the existing numbers at certain schools so that they can deal with the children who have certain challenges. Mr. Speaker, I want to speak to other portfolio areas that the Prime Minister would have mentioned in his budget. Agriculture. Mr. Speaker, I represent a banana producing community. My constituency sits in an agricultural belt. And when I learned that agriculture, according to the Social and Economic Review, grew by 10% thereabout, Mr. Speaker, I had reason to celebrate. Because I know that the Member of Parliament for Denry South, I know the efforts that he made, Mr. Speaker, to reach out to the farmers of this country, to provide them with implements, to provide them with agrochemicals and give them other forms of support. The farm labor support programs, covering, oils for their bananas, and the list goes on and on. And so, Mr. Speaker, I am elated that he did so. Mr. Speaker, lands and housing. You heard the policy pronouncements on housing, and the Prime Minister did say that quite apart from mentioning Talvin and the housing project to come in the constituency of ancillary canneries, that there are other initiatives that will be embarked on. Right here in this house, less than a month ago, I came and I spoke about the advanced plans of our government to develop a community in Olio known as Madwa, where we have actually gotten surveys. Lots have been demarcated on crown lands. Mr. Speaker, in anticipation of my presentation today, a candidate for the United Workers' Party this morning puts out a video where he has a development plan for the same Madwa that I spoke about. Mr. Speaker, and that is how people become misguided. The easiest way to become misguided in politics is when you are following a leader with no vision. A leader who bluffs. A leader, Mr. Speaker, who comes and he promises pie in the sky. A leader who wasted 5 years, dragged this country into a 6th year, and then was deposed. He was gotten rid of. And that is what we are beginning to see manifesting itself in Denry North. So that on the weekend, Mr. Speaker, everybody knows that we have embarked on a fencing program at the Larry Soos playing field. Mr. Speaker, when I was the Minister for Youth Development and Sports in 2011 to 2016, we acquired lands adjacent to the Larry Soos playing field to have an expanded surface, redirected the waterway, the river, paid lands for land acquisition, paid people for land acquisition, crop compensation for everybody who farmed there. People who were paid. A deceased man, Makiba, got $87,000 for a foundation for a house that he started building there. And guess what, Mr. Speaker? Last week, a misguided Denry North candidate, he goes to 2 gentlemen and is trying to get from them disparaging words about myself and the project, and he has somebody recording asking the men to speak against the project and by extension the MP for Denry North. Mr. Speaker, I called one of the gentlemen who was in my office 3 days before on Constituency Day. He told me what losses he suffered. I explained to him that government had compensated everybody who was farming in that area.
15 minutes left.
How much?
15.
Thank you. Government had compensated everybody who farmed in the area. But people still went and they cultivated. But Mr. Speaker, I know the gentleman's circumstances. My retort to them was, look, government has paid monies. I will not make representation on your behalf at the level of cabinet or in parliament, but instead, if it has to come from my personal funds, I will compensate you, and we agreed to that. But it was politically expedient to go and record somebody. And they are 2 of my strongest supporters, you know, Mr. Speaker. And if I'm missing 2 votes to win the elections and I see Arthur and Ital coming, I will begin to celebrate. Come and provide your alternative policies. And they say, Mr. Speaker, I don't even want to take the liberties to say how many scholarships. I will not. Scholarships. As I said before, and I will say again, we have had more university scholarships in Denry North from 2021 to now than we had from 1979 when St. Lucia became independent to 2021 when the St. Lucia Labour Party. For 5 years, nothing, no roads, no footpaths, no drains, no scholarships. I could have done nothing for 5 years. Today I come and I'm trying to address a deficit with road infrastructure, and you have a problem with the concrete trucks. Guess what? More concrete trucks to come. And if you have a problem with the concrete trucks, find another place to stay. The valley is not the place for you. The Austin Hill Road. I've told this story here a million times before. Chimé mon Austin. Premier ministre, c'était ministre qui tenait responsabilité pour infrastructure. Nous pas tenir assez là pour faire whole chemin. Mais nous prenons beaucoup un homme qui a mort, M. Scott, et nous mettons un corner passer M. Gordon. Parce que c'est la machine qui nous monte en Adem Adigua, c'est un struggle. Moun qui nous boutique plus haut, good vic là, pas de ça monter là pour service. So nous avons fait un chimère. Et après l'élection, nous avons fini chimère. Nous perdons l'élection. Flambeau vini. En bas, Jid, même parlement pour Mikoutsaouf. Il pas fini chimère. Because, même quand tout le monde nous savent, pour punir moi, so là, il pas fait, moun qui a dit, Sean pas fini faire chimère, et que vote contre moi. C'est ça, il est quoi? Quand moi, I fini chimère, Austin Hill. I finished it. The same thing he did for the health center to punish me and the Labour Party supporters in Denry North. He found the money in the budget. He took it out, but he was busy spending money to facilitate horses. But he couldn't look after the basic needs of communities. And today you can muster the courage to come and talk. Talk. Mr. Speaker, there is room for dignity in politics. And shame does not always reside in the politics. It doesn't have to in the politics. And that is what I suffered at his hands. So when his surrogates, and I made the point in ancillary, and they twisted it to make it seem as if I was vilifying people unnecessarily. Any prime minister, and if tomorrow the member for ancillary countries becomes the prime minister, and he denies duly elected members resources to do projects in their constituencies, I will vilify him the same way. And if the member for Denry South becomes the prime minister and he does it, I will vilify him the same way. This is the worst act in Parliament ever committed against duly elected members, where unilaterally you can just starve off of resources because you believe you are mighty and you are strong, and then he's afraid to put on his mic and speak. So he wants everybody to speak before him, Mr. Speaker, so he can come after everybody has spoken to insulate himself. Coward. The biggest act of cowardice. I was a student in Trinidad, and when deceased Patrick Manning presented the budget on Power 102 FM, next day I'm tuned in because Kamala Persad Bissessa is responding to the budget everywhere else in the Caribbean. But I challenge him to come and put on his mic and respond to any budget, be it the estimates or the policy statement as presented by the Prime Minister. So, Mr. Speaker, we have embarked on a comprehensive program to transform this country. We got our mandate from the people of this country. I got my mandate from the people of Denry North. I'm happy to report today that the policies of this government are benefiting the people of Denry North in ways they never imagined before. Our roads have been improved, and there are more roads to come, Mr. Speaker. Our health center has been recommissioned. We have done work on every school in the constituency, Mr. Speaker, to rehabilitate to the best of our abilities within the confines of what is available. We are providing scholarship to the children of ordinary people. And I remember the days when schools like the Larissus Combined, there was no Olio Combined School yet. It was Larissus Combined, Daniel Riviere. And at Daniel Riviere, you would move from kindergarten, we call it now, from stage 1 to standard 2, and you had to go to Larissus for 2 years to finish primary education, do common entrance, and then go to a secondary school. You know what they used to call us? Together with Roseau Combined, Miku Primary, schools within the Banana Belt. That's how they called us. Very little regard for us. And as far as a lot of people were concerned at the time, we didn't have the capacity to learn and to do. I am a product of the Banana Belt. I am standing here today, and nobody, Mr. Speaker, it doesn't matter where you come from. It doesn't matter where you have been before. You will not posture in any way, and have a responsibility, not only to the people of Denry North, but to marginalized people in St. Lucia. So that when somebody applies for a scholarship and they're from Monsieur, or they're from Gayabois, or they're from Belvedere, once, Mr. Speaker, if they're from Maynard Hill or Tourouge, or they're from Pom, or they're from Monkey Tongue, or they're from Bolo Bell, it doesn't matter where they're from. Once they have the requirements, I will ensure through a meritocracy that they get their fair share of the pie. And they too can go to university, and they too can return, and they can walk the floors of the hospitals as trained doctors. They can sit at the Ministry of Infrastructure and design roads and buildings because they have been exposed to quality education elsewhere, and education that otherwise they would never have gotten because of the socio-economic circumstances at home. At a time when scholarships were supposed to have been provided to the people of this country. The tractors, Mr. Speaker, were loud in Beaufort. And the later it got in the night, the louder the sounds of the tractors preparing race tracks for horses to gallop. And St. Lucians are struggling. Hospitals do not have supplies. Roads are in a deplorable condition. Banana farmers have been duped and fooled because their fruits can't go to France. And people come here and want to advise. And the member for Choiseul, Mr. Speaker, want to talk about stopping projects. Where was he when all of this was happening? He could have silently said, he could have been that defining factor who put up his hand and stand for St. Lucians. But he tacitly endorsed it, Mr. Speaker. He tacitly endorsed it. And today he wants to talk about his facility is not being open, Mr. Speaker. But I said in the estimates, and I'll say it again, there's monies for the CDP. You will benefit in much the same way when I receive from my team from plant and equipment the schools to be repaired in Choiseul, Mr. Speaker. I contact him and he participates in the process and he recommends contractors of his choice to do work in his constituency. I could have taken a position and say, well, I got nothing. I could have taken a position and say, I got nothing. I could have gotten a position where I say I got nothing and do the same. But that's not me, Mr. Speaker. That is not me, Mr. Speaker. No, you're above my pay grade. You're above my pay grade. So, Mr. Speaker, I support this budget. This budget is in the best interest of the people of St. Lucia and Dennery North. And let me say, Mr. Speaker, that despite all of the maligning that they try, every single week, Mr. Speaker, I am being disparaged. I am being called names. I am being maligned. I'm being accused. I'm being lied about, Mr. Speaker, all because they want my seat. But you know what, Mr. Speaker? The songs are already being composed. And for most of them, the chorus is 4 in a row. 4 in a row, Mr. Speaker. I am not flashy.
Member for Dennery North, you have 5 minutes left.
Thank you, Mr. Speaker. I'm not flashy, Mr. Speaker. My home is a very modest place, Mr. Speaker. It doesn't even have a fence, Mr. Speaker. That is where I live. I don't have any lavish lifestyle, Mr. Speaker. I'm a simple man. And night and day, they take turns, Mr. Speaker. They take turns, Mr. Speaker, to denigrate me, to sully my name, to destroy my reputation, all because they want my seat. But, Mr. Speaker, if they believe that by going live on Facebook, by trying to interview people, my supporters to speak against me, that this is going to give them an advantage, I have never felt more fortified in the politics than I feel now. And whether the member for Castries East decides to go this year, or he goes next year, as I believe he will, Mr. Speaker, it will be shown again under St. Lucia Labour Party in Denver. Mr. Speaker, I support this budget. I support the Honorable Prime Minister. And I want to say, Mr. Speaker, to this Honorable House, that the biggest act of travesty or the worst thing that can happen to this country is to ever entrust the reins of government in the hands of the member for Mikud South. But, Mr. Speaker, nothing remains a secret in St. Lucia. You're hearing the gossip and the soupçon all over the place. There is turmoil in his camp, Mr. Speaker. They do not want him, Mr. Speaker. Mr. Speaker, people are now being recruited because they've been told that if you look at the United Workers' Party landscape, sooner than later, there will be a leadership vacancy. And you qualify, and you can do it. Mr. Speaker, on behalf of the people of Dennery North, I want to thank you for your indulgence. I want to thank my colleagues for their support. I want to thank the staff of the Ministry of Education, Sustainable Development, Innovation, Science, Technology, and Vocational Training. I want to thank my support team in the Mabuya Valley. I want to thank my family and all my supporters for their steadfast support on this journey. It has not been easy, Mr. Speaker, but I remain steadfast and committed in providing quality representation to the people of Denry North and to lead the ministry and the agencies in my ministerial remit to the best of my ability. Thank you, Mr. Speaker.
Leader of Government Business.
Mr. Speaker, I move that this House stands suspended until 9 in the forenoon. 9. At 9. Tomorrow.
Honorable members, the question is that this House stands suspended until 9 o'clock in the forenoon tomorrow, 25th April. And now for the question, as many as of that opinion say aye. As many as of a contrary opinion say no. I think the ayes have it. The ayes have it. Sitting suspended.
You have been watching the live proceedings of the debate, the 2025-2026 budget debate. Thank you so much for staying with us today. And as you just heard, the House has adjourned or is suspended until tomorrow morning at 9. So most of the government parliamentarians, they gave their overwhelming support to the Prime Minister's budget. Over to you, Michael.
Merci, Virgil. Quand nous sommes c'est ce on est fini. Dernier monde qui parlait, c'était honorable Sean Edwards, c'est le ministre qui est responsable des affaires, éducation et développement durable. Et aussi c'est membre parlement pour Nord-Denny qui va un bel rapport, enfin on n'a pas dit un bel rapport, un rapport qui en chaque détail à ce qui est passé en ministre avec un constituency. La tenue l'autre ministre qui parlait, mais nous avons discuté ça peut-être en l'autre plaît. Ça c'est nous avons remercié, nous avons prendre l'occasion pour remercier pour attention pour rester puis nous avec nous avons ici encore demain matin à 9h pour continuer dans la deuxième journée de débat à ce budget qui est présenté par Premier ministre honorable Philippe J. Pierre.